नमस्ते, गुड मॉर्निंग साथियों। आप सभी का इस थर्ड इंटरनेशनल एक्यूकॉन में मैं डॉक्टर ए के जैन एसबी पास की ओर से स्वागत करता हूं। और आज के इस कार्यक्रम को आयोजित करने के लिए मैं आमंत्रित करता हूं डॉक्टर आलोक द्विवेदी सर को।
Namaskar and good morning and welcome back to this second day of Acu-Con 2024. कल एक्यू के इस विराट विज्ञान की एक वानगी हम लोगों ने प्रत्यक्ष की and we realized that there is a specialty in this science. The roots of this vast science are still embedded in the age-old tradition of Ayurveda, and its, stem and the leaf, they are touching to the modern science, modern medical science. तो जो हमारी पारंपरिक विज्ञान है, जो आयुर्वेद जिसको हम इसके नाम से जानते हैं, जब उसके सिद्धांत आधुनिक विज्ञान उसको सत्यापित कर देता है तो उससे हमारा भरोसा बढ़ जाता है। और भरोसा, जैसा हम जानते हैं, श्रद्धावान लभते ज्ञानम। श्रद्धा अगर है मन में तो उससे सब कुछ संभव है। तो हमने देखा कि ये जो विज्ञान है ये किस तरह से लाभकारी हैं। ना सिर्फ ये, इनके कोई साइड इफेक्ट्स भी नहीं है, और ये बहुत कम खर्चे में या ना के बराबर खर्चे में हमको स्वास्थ्य प्रदान करते हैं, और उतने ही कारगर हैं जितने ये सस्ते हैं। तो इन के माध्यम से आज हमारे बीच में और 3 बड़े बड़े मूर्धन्य विश्वविख्यात एक्यू के वैज्ञानिक उपलब्ध हैं हमारे साथ में, और ये हमको आज बताएंगे कि किस तरह से हम अपने स्वास्थ्य की रक्षा इस विज्ञान के माध्यम से कर सकते हैं। ये विज्ञान जो है वो हम सभी जानते हैं, इट प्रमोट्स हेल्थ एंड प्रोस्पेरिटी, नॉट द बिजनेस। इसलिए जो है वो शायद इसका उतना प्रचार प्रसार नहीं हो पाया है। तो इसलिए, क्योंकि हम सभी लोग समझदार हैं, वी लेट अस कम टुगेदर एंड ट्राई टू अंडरस्टैंड। इसको जितना हम बारीकी से समझ पाएंगे उतना ही हमारी श्रद्धा जागेगी, और जितनी श्रद्धा जागेगी उतना ही हम इससे लाभ ले सकते हैं। तो मेरी ये अभिलाषा है कि आज के जो सेशंस हैं, टेक्निकल सेशंस, वो हम सभी लोगों के लिए बहुत लाभकारी रहेंगे। और नाउ आई रिक्वेस्ट साक्षी मैडम टू गो फॉर द प्रेयर। हम सभी के बिहाफ पर वो प्रार्थना करें।
नमस्कार एवरीवन, थैंक यू सो मच सर। प्रत्येक कार्यक्रम की शुरुआत हम प्रार्थना से करते हैं। मेरा सभी से निवेदन है, दोनों हाथों को नमस्कार मुद्रा में जोड़ें, पलकें सहजता से बंद रखिए, रीढ़ और गर्दन सीधी, चेहरे पर प्रसन्नता के भाव। दीपक की आराधना के साथ हम ज्ञान ज्योति को नमन करेंगे। ओम के उच्चारण पश्चात मन में प्रार्थना दोहराएं। ओम शुभं करोति कल्याणम् आरोग्यं धनसम्पदाम् शत्रुबुद्धि विनाशाय दीपज्योतिर्नमोऽस्तुते। दीपज्योति परं ज्योति दीपज्योतिर्जनार्दन दीपो हरतु मे पापम् दीपज्योतिर्नमोऽस्तुते। दीपज्योतिर्नमोऽस्तुते। ओम शांति शांति शांति। नमन करें। इसी के साथ हम कार्यक्रम शुरुआत करने से पूर्व आप सभी को एक बार फिर हमारी संस्था से परिचित करवाना चाहूंगी। एसबी पास सुंदरबाई फूलचंद जी आदर्श शिक्षा संस्थान इंदौर मध्य प्रदेश में स्थित कंप्लीट होलिस्टिक ट्रीटमेंट एंड ट्रेनिंग सेंटर है, जो विगत 30 वर्षों से स्वास्थ्य व चिकित्सा के क्षेत्र में अनवरत कार्यरत है। डॉक्टर ए.के. जैन सर द्वारा इस संस्था की अध्यक्षता की जा रही है और संस्था विशेष रूप से होलिस्टिक मेडिसिन, एक्यूप्रेशर, प्राकृतिक चिकित्सा व योग के क्षेत्र में कार्यरत है। इन सभी के सर्टिफिकेट व डिप्लोमा कोर्सेज का संचालन भी एसबी पास द्वारा किया जा रहा है। वर्तमान में संस्था योग सर्टिफिकेशन बोर्ड वाईसीबी के द्वारा भारत सरकार द्वारा मान्यता प्राप्त मध्य प्रदेश का पहला सर्टिफाइड योग स्कूल है और वाईसीबी के प्रोफेशनल पाठ्यक्रम जैसे योगा प्रोटोकॉल इंस्ट्रक्टर, योगा वेलनेस इंस्ट्रक्टर और योगा वॉलेंटियर, इन कोर्सेज का सफल संचालन भी किया जा रहा है। देश और विदेश में इसके प्रशिक्षण कार्यक्रम ऑनलाइन व ऑफलाइन मोड से किए जाते हैं। प्रत्येक वर्ष 21 जून अंतर्राष्ट्रीय योग दिवस पर भी देश के विभिन्न स्थानों पर ऑफलाइन और ऑनलाइन हाइब्रिड मोड पर वेबिनार्स का आयोजन भी किया जाता है। संस्था प्रतिवर्ष 18 नवंबर प्राकृतिक चिकित्सा दिवस के रूप में निशुल्क प्राकृतिक चिकित्सा उपचार शिविर का आयोजन भी करती है और एसबी पास नेशनल इंस्टीट्यूट ऑफ नेचुरोपैथी एनआईएन पुणे के सहयोग से कई गतिविधियों का संचालन करती है और प्राकृतिक चिकित्सा के सर्टिफिकेट और डिप्लोमा पाठ्यक्रमों की भी नियमित रूप से संचालन किया जाता है। एसबी पास संस्था वर्ष 2001 से भारत के शीर्ष एक्यूप्रेशर केंद्र, एक्यूप्रेशर शोध एवं उपचार संस्थान एस्पस प्रयागराज से संबंधित है। Also, it is cooperated with Indian Academy of Acupuncture Science, Aurangabad, Association of Acupuncture Science Practitioners, AASP, Mumbai, Maharashtra, and Ishan, Bangalore. एक्यूप्रेशर सर्टिफिकेट, डिप्लोमा और डिग्री कोर्सेज का ऑनलाइन ऑफलाइन वीकेंड क्लासेस का संचालन भी एसबी पास द्वारा किया जाता है और विगत 2 वर्षों से संस्था ऑनलाइन वेबिनार के रूप में इंटरनेशनल कॉन्फ्रेंस ऑफ एक्यूप्रेशर Acu-Con का आयोजन भी कर रही है, जिसका मुख्य उद्देश्य देश और विदेश के प्रख्यात विशेषज्ञों द्वारा एक्यूप्रेशर की इस विधा की जानकारी प्रदान करके एक्यूप्रेशर के इस ज्ञान को जन जन तक पहुंचाना है। संस्था के द्वारा निशुल्क सेमिनार, हेल्थ अवेयरनेस कैंप और वेबिनार का समय समय पर आयोजन किया जाता है, जिसके माध्यम से हम अपने उद्देश्य कंप्लीट होलिस्टिक ट्रीटमेंट को प्रोत्साहित करने हेतु अग्रसर है। इस उद्देश्य की प्राप्ति के लिए एसबी पास की संपूर्ण टीम लगातार कार्यरत है और आप सभी का सहयोग अपेक्षित है। थैंक यू सो मच एवरीवन। Now I would like to over to the management. आप हमारे सभी जो गेस्ट है वो जुड़ चुके हैं। I would like to over to sir. Thank you so much.
Thank you very much, साक्षी। थैंक यू। आप सभी का पुनः इस 3rd इंटरनेशनल एक्यूकॉन में मैं स्वागत करता हूं। आज के इस कार्यक्रम के हमारे मुख्य अतिथि के रूप में हमारे साथ में एक्यूप्रेशर शोध प्रशिक्षण एवं उपचार संस्थान के सम्माननीय अध्यक्ष श्री जेपी अग्रवाल सर का मैं स्वागत करता हूं और साथ में इंडियन एकेडमी ऑफ एक्यूपंक्चर साइंस के चेयरमैन डॉक्टर पीबी लोहिया सर, आपका भी मैं स्वागत करता हूं। सर किसी आवश्यक कार्य के कारण अभी हमारे साथ नहीं जुड़े हैं, तो सर कुछ देर में हमारे साथ जुड़ जाएंगे। और मैं इस कार्यक्रम की शुरुआत करने के पूर्व आमंत्रित करता हूं डॉक्टर मनीष शर्मा को, जो कि इंडियन एकेडमी ऑफ एक्यूपंक्चर साइंस के डायरेक्टर डॉक्टर पीबी लोहिया सर को इंट्रोड्यूस करेंगे हमारे साथ।
Namaste. So it is a wonderful day today, and we are so glad that we have opportunity to attend this wonderful workshop, wonderful conference about acupuncture, and it is um, a great opportunity for me to introduce you all Professor Sir Dr. P.B. Lohia. So about him, like I was reading about him, like what is his uh, contribution. So there is, like, I was just thinking, like, there is no one, no acupuncturist in India who knows, who don't know about Dr. P.B. Lohia. Okay, the sir has been a pioneer, a pillar in contributing about TCM, traditional Chinese medicine, and establishing it in India. Okay. So I was reading about his qualifications. So he has like a lot of things. Like if I can talk about an hour for about him itself. So there are so many things. So as his expertise, he has been to many continents, to many countries for the lectures like China, Hong Kong, Malaysia, Singapore, Sri Lanka, UK, Spain, Italy, Canada. There are a list of countries he has been for lectures, and his qualification. There's again a list, a big list. So he is MD, FRCP, DIC, MILA from Sri Lanka, MBBS, MCGP, and FIA, acupuncture, India. And he has many degrees from Switzerland, Korea, UK, and Australia, and PhD from Spain, and also trained in China. Okay. Basically, he is MBBS doctor, but he developed interest in traditional medicine, especially in acupuncture, and he has established acupuncture academy, and he is the chairman of Indian Academy of Acupuncture Science, chairman, World Association of Chinese Medicine, Beijing, China, visiting professor, Beijing Meridian Research Center, Professor Emeritus, the Open International University for Complementary Medicine, Sri Lanka, and President, Indian Institute of Holistic Medicine, and the list goes on. So, and there are many achievements and many awards he has been awarded, and world famous doctor award, China 2001, the physician of the century, international honor, Colombo, Sri Lanka in 2000, the Albert Schweitzer International Prize for Medicine in 1999, Appreciation Award, Singapore 2000, and Max Mundi International Award in 96, Best Paper Certificate in Malaysia, and Certificate of Excellence from Sri Lanka 2 times, that is in 94 and in 98, Fellowship Award for Professional Excellence, that is in Dila Pex in 98. And he has many publications, many books, and media presence. He has been very active in the media also, in many articles in the newspaper, many interviews in the magazine and television and radio talks. He also featured in China Radio International, Beijing, Poland TV, and Indian broadcasting channels. So we are so glad, and it is opportunity that still he is active, he is providing his services, and he is giving in knowledge, and he served as a teacher, and more than 10,000 people, 10,000 students he has taught. Still he is teaching, and still we are glad that he is present between us, and we welcome to him. And Professor Sir Dr. P.V. Lohia legacy continues to inspire and impact the world of medicine and holistic healing. So that is about him, and it is I feel like I'm talking so little about him. So there is many things what I am skipping, but there is a lot to learn from him. So we are fortunate to welcome him. Thank you so much.
Thank you very much, Dr. Manish, for introduced Dr. P.B. लोहिया सर. और मुझे लगता है कि भारत में डॉक्टर पीबी लोहिया सर को जितने भी प्रैक्टिशनर्स एक्यूपंक्चर करते हैं, शायद ही कोई ऐसा व्यक्ति होगा जो डॉक्टर पीबी लोहिया सर को नहीं जानता है. और डॉक्टर पीबी लोहिया सर के बारे में ऐसा कहा जाता है, ही इज द फादर ऑफ द एक्यूपंक्चर इन इंडिया. तो मैं अपना प्रणाम करता हूं डॉक्टर पीबी लोहिया सर को, कि जिनके गाइडेंस के कारण हम इस वेबिनार को सक्सेसफुली कंडक्ट कर पा रहे हैं. और जैसे ही हमारे साथ लोहिया सर अगर जुड़ेंगे, हम उनका आशीर्वाद लेंगे. अभी आज के दूसरे मुख्य अतिथि के रूप में हमारे साथ में एक्यूप्रेशर शोध प्रशिक्षण एवं उपचार संस्थान के अध्यक्ष, जो कि श्री जयप्रकाश जी अग्रवाल सर हैं. अगर जिन्हें मैं कहूं तो सर भी देश में एक्यूप्रेशर के पितृपुरुष के रूप में जाने जाते हैं, जिन्होंने एक्यूप्रेशर और उसमें विशेष रूप से आयुर्वेदिक एक्यूप्रेशर के जनक के रूप में आप जाने जाते हैं. तो मैं आपके परिचय के लिए आमंत्रित करता हूं हमारे ही एस्पस के साथी और ईशान के निर्देशक डायरेक्टर श्री एम.वी. रविंद्र जी को. प्लीज सर.
Thank you very much, Dr. Antim Kumar Jain, for giving me this, prestigious, very nice opportunity to introduce my own guru. I'm a disciple of my guru, Shri J.P. Agarwal sir. J.P. Agarwal sir, is not an ordinary person. He is a legendary figure in the field of acupressure in our country. After Dr. Devendra Vora and late Shri Mata Prasad Khemka, the contribution in the field of acupressure by Dr. our beloved Guru Shri J.P. Agarwal sir is, immeasurable. It cannot be measured at all, because I feel that she is like a personality like Dr. Wole, because Dr. Wole has discovered some new insight, new meridians, and redefined the existing TCM meridians. Like that, I call him as a doctor. He is more than a doctor, because his knowledge of anatomy and physiology is uncomparable, better than any of the, I'm not exaggerating, we can compare him to any of the doctors who knows anatomy and physiology. He is second to none. And his best contribution is, he has, like Dr. Wole, he is the person who has developed and given new insight to the Ayurvedic concept of acupressure. Ayurvedic medicine is known to India very well, since thousands of years. But the mode of treatment through acupressure, on the basis of concept of Ayurveda, is only discovered and developed by, the credit should go to only J.P. Agarwal sir. And more than that, not only that, yogic acupressure, CM on Ayurvedic, Chinese meridian on Ayurvedic mold. Then Yemnium, the latest discovery is Yemnium, which is a blend of everything. Dr. Wole's TCM, Ayurvedic, yogic, plus anatomy and physiology. And, the new concept is gaining ground like anything, because its efficacy is very, very, very powerful. Very powerful, with only three points in each meridian, you can treat even a simple disease to complicated diseases, chronic diseases like cancer, like brain diseases, kidney failure diseases, etc. It's a very, what I call, once in, I don't know how one individual can, make so much of contribution in one's life within a span of just 3 decades. And not only that, he has authored more than 100 books, not only textbooks, and the what we call evidence based, what we call based on clinical studies. So many books he has written, especially on MDM and so many things. Even on that Paramasukshma Abhinaya also is a new, what we call insight. Because I myself, once what happened, one patient has come to me for German measles, rubella. In the world, there is no medicine in allopathy for rubella. It is a German measles. And because of in the concept of that Paramasukshma Abhinav, where we use only 2 points in each meridian, like the source point and the zigzag point, to remove any infections, whether it is viral or bacterial or anything. And it was very successful. Like that, his contribution is very great, tallest I can say. I will call him as a Shilpi, because he has the capacity to bring out the best in you. The proof is he has produced more than 100 faculties in our Samsthan who can teach from awareness to 10th semester classes. And he's the greatest propagator of acupressure in our country. He has conducted, he is the main person who is responsible for lots of awareness to semester classes by our Samsthan to propagate this divine sense all over the country. And every Wednesday he conducts one, study circle classes based on clinical studies. And he is with zeal and enthusiasm, he carries forward the motto of our Samsthan to teach one, treat one, and reach one. And more than anything else, he is spiritually an enlightened person. So it is our pleasure and privilege to have him amongst us. And I'm hereby acknowledging and appreciating and honoring him to, bless us here on this occasion. And let us join him in his endeavor of spreading acupressure to the entire country to make our India medicine free. Welcome, sir. We are thrilled to have you amongst us. Pranam.
Thank you, Ravindra sir. Thank you very much for your brief introduction in our respected President Aspas Prayagraj Sansthan, Shri J.P. Agarwal ji. So I request to please bless us, Shri J.P. Agarwal sir.
Thank you, Dr. Jain, Dr. Alok Dwivedi sir, Madam Sakshi ji, and all my dear participants from different branches of acupressure. Now it has become the most holistic, infusing the knowledge of anatomy, physiology, TCM, 1200 points, roughly speaking, of the TCM, and the break points, and infused based on the physiology, anatomy by Dr. Wall. By profession, he was a great allopath, but he was a deep insight into the digital aspect, metaphysics of the this human body, and peeped into the 12 meridians, rather 12 meridians of TCM, and with all extraordinary points and extra point, 200 points. After 200 points, so many points have been added, but with the complete affirmation that this therapy starts from where all these systems end at one place. And it needs no testimony to prove the efficacy of the acupuncture or acupressure or the different branches, whatever you may call it. So now he has provided the biggest platform to the all fraternities, especially the modern scientists, to prove the efficacy and the existence of the TCM, Chinese meridian, which is the responsible for the digital control of human energy system. So nomenclature may be different. Again, I would like to express my gratitude to all the honorable speakers, great celebrities of different walks of life, and especially to Dr. Jan and the complete attitude of gratitude towards SB Pass, which is a complete holistic model of human energy system. It is the combination, whatever he provides the knowledge, the segments of the Ashtanga Yoga, all the alternate medicine, also including based on the physiology anatomy and running different branches and courses and providing the best of the knowledge. I can't say that it is the national, but all the international figures like Dr. Lohia and all those who are providing, and they have the insight and innovative approach towards the acupuncture and different branches. Even the Dr. Jan has combined TCM and the Sujok, yogic acupressure, acupuncture, Dr. Wall's physiology anatomy based electroacupuncture, and we can say Ayurveda is the science relating to life process. So it does not belong to the time and space. It is not confined to the only our country. Rather, it is wherever the life process is there in any species, either creepers, crawlers, plant life, and human beings, lastly, or animal life, whatsoever you call. So this Ayurveda, that is related with the knowledge relating to life process. It means that, but all are complementing. The TCM was practicable by the great invention of Dr. Pardew, who's the beacon light for and combining all the branches. But very soon he has left with the assignment to all of us. And next, that was Dr. Wall. He introduced not only the breakpoints and correlated with all the TCM points with the physiology anatomy. So it attracted the all modern scientists, and many of the governments have approved and introduced. And in our country, Maharashtra government is the first government to introduce this acupuncture. And also, we have nothing at our back which we can profess that, but we are a learner, we are the learner, and always we are in the learning process. My great respect to Honorable Ravindraji, who is a philanthropist, great humanist, and propagator of all the branches of acupressure. Acutherapy, I can call it, because it includes acupuncture, and without TCM, there was no genesis of sujoke, and without sujoke, TCM was never practicable. And the scientific format was provided by Dr. Wall. So many of the doctors, by by profession, they are all allopaths and surgeon. They are associated and learning and working with ASPAS. It is a big family. We are, our existence is not without you. All the, whether it is ISAN or SP Pass or so many such offshoots of the or offshoots, or we can say that they are the regional and now national and working on the national or international level. So all of us are the part, and we are complementary, just like in Yang. It is not antagonistic. We don't have any. We have a lot of respect to Dr. A.K. Jain, who made me to introduce online classes during the COVID. And it proved a great success story. And the now we are doing online classes, teaching, and also the treatment. And we keep ourselves busy in the service of humanity. Today, I would like to Dr. A.K. Jain to give the few pages so that this acupressure can be applied for the autism, CP child, and so many such undefined disease process, prenatal and postnatal, by virtue of putting one pressure by finger pressure or magnet or the seed. Can you believe that delayed my Mr. Jain, please display the, because time is very short and only few minutes will be taken up, and
Actually,
everybody should use and
can
apply.
share.
So delayed milestone or the CP child, ADST, or likewise, so many such symptoms that the children, one child in the family, if disabled under the nomenclature of anything, it is a great thing. It may be this disability or may be caused due to prenatal stage. The people sometimes call it the degeneration in the DNA or RNA, but I don't think so. It is the carrier disease. During the womb, the embryo and embryo stage, there is some degeneration in the fetus. So prenatal, this can be easily managed. And if during the discharge of the pregnancy cells, some forceps injury causing delayed milestone or CP child, something like that can be easily manageable. But it takes time. So please show the, all the special features of INM. It does not mean, it is the combination, holistic approach to have the access to all the problems. And the TCM or Sujok or yogic or Dr. Walls, everything can be taken up together. Now, please take up another page. Now, this is the, these are the classification of our metaphysics or the character. So our conduct, who says that our conduct and the nature cannot be changed? I can say कि हमारा acupressure से, acutherapy से पूरा फिजियोलॉजी, एनाटॉमी यानी चित्र भी बदलता है, और बिहेवियर, कंडक्ट, नेचर, ये सारी चीजें बदलती हैं. मैं आपको एक इसमें ओआर मेरिडियन वी आपने आपने देखा होगा कि हमारे रिसर्च सीनियर रिसर्च वाइस प्रेसिडेंट मिस्टर राम कुमार शर्मा जी ने आपको कल बहुत सी चीजें बताई होंगी, लेकिन आज मुझे एक थोड़ा सा अ, मुझे आदेश प्राप्त हुआ था 5-10 मिनट का, मैंने समय ले लिया। मैं क्षमा याचना के साथ show the PPT page number 4. Yes, this is the for cerebral palsy, ADHD, delayed milestone, autism, ASD, hyperactivity, dementia, bipolar, depression, and all that. The prenatal or the postnatal. Go to again PPT number 4. The simple 4, page number 4, please. Page number 4. You see, there is one channel between middle finger and ring finger. It is touching the two meridians invented by Dr. Wall. These are different from TCM and also different from tissue. These are the 8 combo meridians, meaning thereby you know it, the 8 combo meridian, tissue meridian, ND meridian, fat degeneration, skin degeneration, fiber degeneration, joint degeneration, allergy degeneration, and organ parenchymal. You see, and triple valve and the CI were presented into the different format, and TW meridian is being used for the endocrinal disorders, meaning thereby only the simple pressure on the 3 points. You can see my cursor. Is it seen? Only the same page number. Please. The page number 4. हमारा कर्सर दिखाई पड़ रहा है क्या?
नहीं सर, आप ऑपरेशन आप नहीं कर पा रहे हैं सर।
ओहो,
साक्षी यहाँ
तो
से
ये पुट इन द चैनल नंबर 1. Bring the cursor on the channel number 1.
साक्षी मूव द योर कर्सर बिटवीन द इंडेक्स
Middle
फिंगर
finger
एंड मिडिल
and ring
फिंगर।
finger. Middle and ring finger channel 3 points. 3 points. I should have taken myself, but yes, 3 points. Yes, exactly. 0 point is prenatal point for the ADSD. For the diagnosis, just you put a simple pressure on this point. You can see on my hand. Simple pressure gives the lot of change and vibrations and commotion in the energy system. And this is very well proved on so many such CP children and with the good response. But it takes time. Online, the people they get, it is very simple to put the pressure and to apply the ball magnet 0, 1, 2 for all such CP child. CP, the treatment on 0, 1, 2, 3 ball magnets should be put up, and for 2 hours in the beginning for 1 month, and after 1 month 4 hours. This is the kind of adaptation. This is need not to see my hand. ये आप हाथ में देखें जहां पे कर्सर जा रहा है मिडिल में चैनल नंबर 1 पे, उसी पे प्लीज उसी पे रखें। हाँ, कर्सर 0, 1, 2, गो टू 1 and 2, ऑल दीज 3 पॉइंट्स। अगर आपको किसी प्रकार का संशय है तो इस पे आप स्टार मैग्नेट, नहीं तो सीड भी लगाकर पेपर टेप से चिपका दें एंड यू विल गेट द रिस्पॉन्स। एक बात और मैं बताना चाहता हूँ, आप में से 90% लोग किसी न किसी रूप से स्पाइन के डिसऑर्डर से, सर्वाइकल या लंबोसेक्रल रीजन में, इसी चैनल पे आप लोग बैठे हैं, more than 300 persons or more than 350 persons. Just you can apply the pressure on this in this channel between ring finger, put pressure. Immediately you'll have relief. If you put pressure on number 2 and 1, immediately you will get relief in your low backache. And 0, 1, 2, all the just you put the just like pressure. Need not to go for the applying magnets and all that. You can immediately you can notice the change. Likewise, more than 100 or 300 symptoms can be treated by this channel alone. Now, is it not the magic? It is the magic of because we are bestowed with the energy system through our parents from Almighty God. And it is very well connected. And this metaphysics, the energy system, meridian system, is totally based on TCM concept and furthermore all. Thank you. आप लोग, मैं आपसे एक बात जानना चाहूंगा कि क्या आप लोग ने इसको यूज किया बैठकर अभी किसी को भी, क्योंकि कमर का दर्द है, गर्दन का दर्द है और उसकी पेरिफेरल नर्व का रेमिफिकेशन इट गोज टू आपके हिप जॉइंट पे है, नी जॉइंट पे है, एंड इट कैन प्रोवाइड द सर्जिकल इफेक्ट. अगर बहुत ज्यादा ऑस्टियोफाइट्स और डिस्टॉर्शन है, इट टेक्स टाइम, अदरवाइज पेन आप इमीडिएटली आप नोटिस कर सकते हैं. समय के अभाव के कारण मैं बहुत सी बातें हैं, लेकिन एक छोटी सी बात मैंने इस चैनल में OR यानी प्री नेटल और पोस्ट नेटल जितने भी प्रॉब्लम्स हैं उनको AD मेरिडियन के साथ कंबाइन करके दोनों कॉम्बो सुपर कॉम्बो मेरिडियंस हैं एंड इट कैन ट्रीट सो मेनी थिंग. ओवर टू डॉक्टर A.K. जैन.
थैंक यू सर.
पुनः आपको सबको मेरा आभार और अभिवादन.
धन्यवाद सर. प्रणाम सर. सर पुनः आपको धन्यवाद कि आपने अति व्यस्ततम समय में से आप हमारे साथ ज्वाइन किए. और साथियों की जैसा आदरणीय अग्रवाल सर ने अभी आपको YNM के बारे में बताया, तो इस तरह के ट्रेनिंग वर्कशॉप्स हमारे प्रयागराज संस्थान द्वारा नियमित होते हैं और उन सभी की ट्रेनिंग आप नियमित लीजिए ताकि आप अपने नॉलेज को अपडेशंस करें. और अभी मैं अगले वक्ता के रूप में आमंत्रित करता हूं. उससे पहले मैं हम सबकी ओर से आदरणीय JP अग्रवाल सर को धन्यवाद देता हूं कि सर हमें हमेशा मार्गदर्शन देते रहते हैं और ऐसे ही हमारा आपका आशीर्वाद हमें सदा मिलते रहे. पुनः धन्यवाद सर. आज के हमारे अगले मुख्य स्पीकर के रूप में हमारे साथ में जुड़े हैं, जो कि यहाँ के रिनाउंड एक्यूपंक्चरिस्ट हैं, डॉक्टर योगेश कोटकानी सर. स्वयं MBBS डॉक्टर हैं. और आपके इंट्रोडक्शन के लिए मैं आमंत्रित करता हूँ श्री लक्ष्मण कृष्णमूर्ति, जो कि ईशान से हैं. साथ ही मैं अपने स्पीकर से रिक्वेस्ट करूंगा कि आप दोनों ही लैंग्वेज का यूज करें, हिंदी इंग्लिश, ताकि हमारे साथ नॉर्थ और साउथ के जो पार्टिसिपेंट्स हैं दोनों ही आपकी बातचीत से लाभान्वित हो सकें. तो ओवर टू कृष्णमूर्ति जी.
Namaste to everyone. Hope I'm audible and visible. Okay. How can you be destined to be a doctor as soon as you take a birth? Probably one of the reason could be if your father is a very famous doctor, then the moment you take birth, you will also be destined to be a doctor. It is something similar to which what happened to Dr. Yogesh Kodkani. His father was a very famous doctor in the region, and the moment he took birth, he also was destined to become a doctor. While he was doing his MBBS studies, he saw there were so many questions which were unanswered. He was looking for deeper answers to the questions which was not available to him in the Western medicine studies. So while studying itself, he was thinking of learning alternative medicines and other holistic way of healing the human body. So he completed his medical studies, MBBS studies, but never practiced it. So as soon as he completed his MBBS, he learned other modes of healing systems such as homeopathy, acupressure, acupuncture, and then he started practicing those, where he could find the answers which he could not find in the allopathy medical system. And then the journey of healing people through the alternative medicine started, and it started in around 1994, and for so many decades Dr. Yogesh has been serving people through this natural and holistic way of healing things. He has done his post-graduation in homeopathy. He has done his post-graduation diploma in holistic healthcare. He has done his PhD in pulse diagnosis. He has done his MD in acupuncture, and he has done many other courses. And he has been recognized for the great work that he has done. He has been awarded with so many distinguished awards, and he has also presented many research papers in national and international conferences. And the biggest achievement, or one of the biggest achievements Sir has achieved, is to get the recognition. He has played one of the important leading roles in getting the recognition for acupuncture, both in Maharashtra state and national level, by actively networking with the concerned politicians and government authorities. As a result, the Maharashtra Acupuncture Council has been established, and the Apex Committee for Acupuncture has been formed at the center. He has held many positions in his career. He has been co-convener of Maharashtra and chief convener at Mumbai for the BJP National Medical Cell. He is vice president of Maharashtra International Sujok Association, and he is part of the teachers selection and teacher training panel of Maharashtra Council of Acupuncture, and many other positions has been held by Dr. Vivek. In my practice, I see miracles every day. Like miracles becomes a day-to-day affair, and that can happen through right diagnosis. And the right diagnosis, like there are so many variations in that, we will have to understand the right path of the energy, right imbalance in the energy. And sir is going to take us through this wonderful way of understanding the differences in the different types of diabetes as per TCM. There are 10 different types of diabetes and how to identify and treat them. So sir will be teaching us on this wonderful topic. Okay. So with this, I welcome Dr. Yogesh and hand over the session to him. Thank you, sir.
Thank you, Mr. Krishnamurthy. That was a very nice introduction, and I'm really feeling enlivened. I'm especially enlivened because I'm presenting in the presence of Dr. J.P. Agarwal, who is such a brilliant, I would say, sun, not a star, in the horizon of alternate medicine. It's really an honor to be presenting in his presence. I'm very thankful to Dr. A.K. Jain for inviting me for this seminar so that I can present this presentation on 10 types of diabetes, which is, I feel, is very important for today's world, because Diabetes is one disease which is not limited to one organ. It kind of affects your whole body, starting from your eyes to your feet. Everything is affected by diabetes. And if a person is suffering from incurable diabetes of any kind, even those which are controlled by allopathic medicines, they also suffer from severe side effects, and even effects of diabetes are evident in people whose diabetes is even under control. So it's something that needs to be treated from the root. And if we want to understand what is the root, we really need to be able to understand what are the different types of diabetes. So as far as modern medicine is concerned, it just simply divides them into primarily two types. It does not really differentiate much into them, except maybe a third type of pregnancy induced. But otherwise, it simply talks about type 1, type 2. Now, just that much knowledge is not enough, because there are so many different reasons why a person can suffer from diabetes. And during my practice, I was initially, it was just the simple points which I was using, like SP6 and other points with Li4, other points which are homeostatic and all that. But some people would respond very nicely. There were some people who simply did not respond. So that led me to think that there must be something much more than what meets the eye. And during this course, I also got interested into study of pulse diagnosis. So I tried my best to study wherever I could, whatever I could. But unfortunately, I did not get much knowledge from outside. So then I turned inward. I prayed to God. I really pleaded with God to let me into the secrets of pulse. And by His causeless mercy, I was able to uh, get my understanding of a system which I have now named as Ashtadha Nadi Vidya, the science of 8-element pulse diagnosis. So this, with this knowledge, I was able to diagnose my diabetic patients more deeply, and through this knowledge, I was able to treat them better. So without diagnosis, perfect diagnosis, perfect treatment is not possible. So I would like to tell you a little bit about this Ashtadha Nadi Vidya before I start my presentation on 10 types of diabetes. So according to Ashtadha Nadi Vidya, there are 8 energies. Everyone is made of 8 energies. It is there in the Bhagavad Gita. Bhumi Rapo Nalo Vayu Kham Mano Buddhi Revacha Ahankara Ityam Me Bhinna Prakriti Ashtadha. So there are 8 energies: earth, water, fire, air, ether, mind, intelligence, and false ego. These are the 8 energies from which the whole universe, including our bodies, they are made of. So if we are made of these energies, any imbalance in any of these energies, right up from intelligence, from ego, down to earth, and whatever is in between. So any imbalance in any of these energies can cause disease. So with this understanding, I was able to find the root cause of the disease. So we know, according to the 5-element cycle, every organ is supposed to have one predominant energy in it. And it is not just that that energy is there, it has all the energies, but one of the energies is predominant. Now, this predominant energy, if it is disturbed, that means the whole organ is disturbed. And when an organ is disturbed, it can also disturb the other organs through which it has got relations through the mother-son law or through the controlling cycle. Now, with this understanding, I was able to diagnose what energy is currently there in a particular organ. Is it the energy which is supposed to be there, or is it some other energy which is not supposed to be there? So if we are able to do this, we are able to remove the energy which is not supposed to be there and restore the energy which is supposed to be there in that particular organ. Now let us start the presentation with this background. Are you able to see my screen?
Yes,
Dr. Jain?
yes, sir. Yes, sir.
Okay, thank you.
Sir, may I request to you, please, use the both language.
Yes, yes, I will.
Because Hindi participant also
Sure,
benefited.
sure.
Thank you, sir.
Okay. So as I said, generally diabetes को दो टाइप में डिवाइड किया जाता है, टाइप 1, टाइप 2 में. बट हमने थोड़ा रिसर्च करके इसमें 10 टाइप्स डिस्कवर किए हैं और अभी हम उनके बारे में देखेंगे. तो टाइप 1 होता है जिसमें एक्चुअल डेफिशिएंसी ऑफ इंसुलिन होते हैं, इंसुलिन की कमतरता होती है बॉडी में, सिक्रीशन कम होता है इंसुलिन का, वो है टाइप 1. और दूसरा है टाइप 2 जिसमें कि इंसुलिन नॉर्मल होने के बावजूद डायबिटीज होता है. तो इसका मतलब इसमें जो इंसुलिन है वो काम नहीं कर पाता बॉडी में. तो ये बेसिक 2 टाइप्स है, टाइप 1, टाइप 2. अभी ये जो टाइप 1, टाइप 2 है ये तो रहेंगे, इसके अंदर सब टाइप्स है. जिन सब टाइप्स को हमने डिस्कवर किया है कि ये सब टाइप्स जो है, अगर हम इनका जो कॉज है इनको अगर हम समझ सके तो हम इनको ठीक से रूट कॉज से ठीक कर सकते हैं. तो अभी हम देखेंगे टाइप 1. इसमें हमने 6 सब टाइप्स डिफाइन किए हैं. एक टाइप 1 के अंडर पहला टाइप है जिसमें ओवरऑल डेफिशिएंसी ऑफ इंसुलिन होती है पैनक्रियाज में. तो ओवरऑल डेफिशिएंसी ऑफ एनर्जी, यानी पैनक्रियाज जो इंसुलिन प्रोड्यूस करता है उसकी एनर्जी ही कम रहती है ओवरऑल. तो वो ऑर्गन में ही कम एनर्जी है. तो अगर ऑर्गन में एनर्जी कम है तो इसको कैसे मालूम पड़ता है? अष्टदा नाड़ी विद्या के हिसाब से इसमें ह्यूमिडिटी पल्स जो डिफाइन किया है अष्टदा नाड़ी विद्या में, जो बहुत सिंपल पल्स है, सबसे इजी पल्स है, जिसमें कि आपके फिंगर के अंदर नीचे एक मूवमेंट क्रिएट होती है जो इस तरह की होती है, जो ऊपर जाके नीचे आती है. तो ये जो फीलिंग आता है अगर आपको स्प्लीन के पल्स में, और वो भी जो आपका स्प्लीन का पल्स है जो आपके राइट हैंड के मिडिल फिंगर के नीचे आपको फील होता है, यहाँ पे अगेन आप राइट और लेफ्ट डिफाइन कर सकते हैं. जो आपके राइट हैंड के इस तरफ जो है वो राइट पल्स है और इस तरफ जो है वो लेफ्ट पल्स है. तो ये जो यहाँ पे आप जो फील कर रहे हो, इसके अंडर जो स्प्लीन का पल्स फील हो रहा है, उसमें आप अगर थोड़ी बारकाई से आप उस पर ध्यान दे तो आप, अगर वो डिजीज है तो, अगर वो प्रॉपर है, अगर दोनों साइड बैलेंस है स्प्लीन के, तो आपको एक ही पल्स फील होगा. अगर राइट और लेफ्ट पार्ट्स ऑफ स्प्लीन में अगर कोई भी इम्बैलेंस हो तो आपको ये दोनों पल्स अलग से फील होते हैं. और इसमें अगर आपको नॉर्मल ऐसा जो अगर फील होता है तो वो होता है नॉर्मल ह्यूमिडिटी पल्स. तो अगर ये प्रॉपर फीलिंग आ रही है, स्ट्रॉन्ग फीलिंग आ रही है, तो इसका मतलब बहुत ज्यादा भी नहीं और बहुत कम भी नहीं, एक नॉर्मल फीलिंग आती है, तो इसका मतलब है कि ये इसमें एनर्जी नॉर्मल है. अगर इस पल्स में अगर आपको फीलिंग कम आती है, बहुत वीकली आपको फील हो रहा है ये, तो इसका मतलब ओवरऑल एनर्जी डेफिशिएंसी है पैनक्रियाज में, और इसमें इसकी वजह से इंसुलिन सिक्रीशन बहुत कम हो रहा है. तो दूसरा टाइप जो है वो हम देखते हैं कि अगर राइट जो हमने बताया कि ये जो राइट है, राइट साइड ऑफ स्प्लीन, वहां पे अगर आपको ड्राइनेस पल्स फील हो रहा है जो इस तरह से जाता है नीचे से, आपके फिंगर, अगर आपका फिंगर आप रखते हो तो ऐसे फील होता है कि कुछ नीचे से टर्न होके जा रहा है. तो अगर ये आपको फील हो रहा है तो इसका मतलब है कि यहाँ पे ड्राइनेस एक्सेस है. इसका मतलब अलग लैंग्वेज में आप बात करें तो इसमें सर्कुलेशन की कमी है, हीट की कमी है. तो ये जो अगर इस तरह का जब अगर पल्स आता है, इसका मतलब है कि ड्राइनेस एक्सेस है और आपको इस मेटल एलिमेंट को कम करना है पैनक्रियास से. थर्ड टाइप अगर हम देखने जाए तो पैनक्रियास के अंदर आपको विंड पल्स फील हो सकता है, जो आपको इस तरह फील होता है अपवर्ड. और ये जो अगर आपको फील हो रहा है, इसका मतलब है कि पैनक्रियास में ग्लूकेगॉन सिक्रीशन ज्यादा है और इंसुलिन सिक्रीशन कम है. ग्लूकेगॉन वो हार्मोन है जो ग्लूकोज प्रोड्यूस करने में बॉडी को स्टिमुलेट करता है. तो जो बॉडी में ग्लाइकोजन जो स्टोर होता है लिवर में और मसल्स में, या तो जो फैट है, इसको वो मेल्ट करके ग्लूकोज प्रोड्यूस करता है। तो अगर प्रॉब्लम है तो इसमें विंड यानी कि वुड एलिमेंट ज्यादा है पैनक्रियाज में, उसको आपको कम करके अर्थ एलिमेंट को बढ़ाना होता है। अगर आप आगे जाए तो चौथे टाइप में, अगर आपको सेम उसी जगह पे अगर आपको फील होए, ये राइट साइड ऑफ स्प्लीन पल्स में अगर आपने फील किया और आपको कोल्डनेस पल्स फील हुआ, कोल्डनेस पल्स ऐसा होता है जो नीचे की तरफ जाता है, तो विंड पल्स ऊपर जाता है और ये नीचे की तरफ जाता है। तो अगर आपको ये फील हो रहा है तो आपको ये समझना चाहिए कि यहाँ पे नेक्रोसिस हुआ है पैनक्रियास का। ये कोल्डनेस पल्स इज अ साइन ऑफ डैमेज। तो अगर ये आपको फील होता है तो इसको आपको ये कोल्डनेस एनर्जी कम करनी है वहां से, यानी कि वाटर एलिमेंट पैनक्रियास से कम करना है, और आपको वहां पे हीट हीट और यानी कि फायर और अर्थ एलिमेंट को बढ़ाना है। फिफ्थ टाइप अगर देखें तो हीट इन पैनक्रियास, दैट इज अगर पैनक्रियास में इन्फ्लेमेशन है। देखो, पैनक्रियास का नॉर्मल एनर्जी अर्थ एनर्जी है, ह्यूमिडिटी एनर्जी है। अगर कोई भी दूसरी एनर्जी आ जाए तो प्रॉब्लम होता है। तो हीट अगर पैनक्रियास में ज्यादा है, इसका मतलब पर्सन इज सफरिंग फ्रॉम क्रॉनिक पैनक्रियाटाइटिस। अगर पैनक्रियास में इन्फ्लेमेशन है तो फिर भी पैनक्रियास ठीक से काम नहीं कर पाता, और उसकी वजह से पैनक्रियास का इंसुलिन सिक्रेशन कम हो जाता है। तो पैनक्रियास का इंसुलिन सिक्रेशन आपको नॉर्मलाइज करना है तो आपको पहले उसका इन्फ्लेमेशन कम करना पड़ेगा, तो आपको फायर एलिमेंट कम करना पड़ेगा, हीट कम करनी पड़ेगी। तो यू कैन यूज द पॉइंट्स ऑन स्प्लीन, that is spleen 2 here, to you have to sedate that, and you have to again increase the earth element which is spleen 3। तो इसको आप स्टोनिफाई कर सकते हो और इससे आप पैनक्रियास का इन्फ्लेमेशन कम कर सकते हो। एक टाइप है टाइप 1 डायबिटीज में, द 6th टाइप हियर, विच इज बिकॉज ऑफ ऑटो इम्यून डिजीज। नाउ ऑटो इम्यून डिजीज अगर पैनक्रियास के सेल को अटैक कर रहा है तो इसमें आपको लेफ्ट साइड ऑफ स्प्लीन, विच इज सी राइट साइड ऑफ स्प्लीन डिनोट इज concerned with insulin secretion, left side is concerned with immunity। तो अगर इम्यूनिटी में अगर ड्राइनेस, लेफ्ट साइड ऑफ स्प्लीन में ड्राइनेस ज्यादा आ रहा हो तो उसका मतलब मेटल एलिमेंट, या तो मेटल एलिमेंट आप कह सकते हो, वो अगर ज्यादा बढ़ जाए तो ऑटो इम्यूनिटी का डिजीज हो जाता है। और ये ऑटो इम्यूनिटी अगर है, ये आपके अगर बीटा सेल्स को अटैक कर रहा है तो आपको राइट साइड पे नहीं बल्कि लेफ्ट साइड ऑफ पैनक्रियास को ट्रीट करना होता है, और ये मेटल एलिमेंट कम करके फायर एलिमेंट बढ़ा के स्प्लीन के एनर्जी को नॉर्मलाइज करना होता है। तो इस तरह से आप जो रूट कॉज है डायबिटीज का, ऑफकोर्स जो भी राइट साइड में डैमेज हुआ है उसको आप ट्रीट करना चाहिए, तो आप उसको अर्थ एलिमेंट टोनिफाई करके वापस उसको बीटा सेल्स को हेल्प कर सकते हो। बट इस तरह से आप टाइप 1 डायबिटीज को ट्रीट कर सकते हो। ऐसा माना जाता है कि टाइप 1 डायबिटीज इज इनक्योरेबल, बट ये गलत है। ये इनक्योरेबल इसलिए अभी तक था क्योंकि किसी को इसको ट्रीट करना समझ में नहीं आया था, कि कॉज अगर समझ में नहीं आया तो ये इसको ट्रीट करना पॉसिबल नहीं। बट अगर आप इस तरह से आप सोचो और इस तरह से आप डायबिटीज टाइप 1 को ट्रीट करो तो डायबिटीज टाइप 1 ठीक हो सकता है। जो इंसुलिन पे जो बच्चे हैं अभी, इनको सबको इंसुलिन से मुक्त किया जा सकता है। तो हम डायबिटीज मुक्त भारत की तरफ हम लोग डेफिनेटली अग्रसर हो सकते हैं। तो अगर नबी हम आएंगे टाइप 2 डायबिटीज, इसमें हमने 4 टाइप्स डिफाइन किए हैं। तो एक टाइप है जिसमें आपके बॉडी में स्टीरॉयड लेवल बहुत ज्यादा है। तो स्टीरॉयड लेवल कहाँ से आता है? ये आता है एड्रिनल, और इसका पल्स जो आपको फील होता है वो किडनी पल्स में। तो आप जानते हैं कि लेफ्ट साइड ऑफ रिस्ट पे जो रिंग फिंगर के नीचे जो है वो होता है आपका किडनी पल्स डीप लेवल पे। तो ये जो डीप लेवल पे आप किडनी पल्स फील कर रहे हो, अगर इसमें आपको ह्यूमिडिटी पल्स जो मैंने पहले बताया इस तरह से जो जाता है, अगर वो ह्यूमिडिटी पल्स फील हो रहा है आपको, तो इसका मतलब है कि किडनी या एड्रिनल्स में ह्यूमिडिटी की मात्रा बहुत ज्यादा है, तो आप उस पे एक्ट करना है। आपको किडनी का अर्थ एलिमेंट कम करना है और वाटर एलिमेंट जो उसका ओरिजिनल एलिमेंट है उसको बढ़ाना है। तो इस तरह से आप एक्यूपंक्चर के थ्रू उसको अफेक्ट कर सकते हो। फिर आता है सेकेंड टाइप, जिसमें होता है हाई लो लो पीएच ऑफ ब्लड, यानी हाई एसिडिक कंडीशन। अगर बॉडी में एसिड बहुत ज्यादा है तो फिर क्या होता है कि जो इंसुलिन मॉलिक्यूल है उसका जो वो डी नेचर हो जाता है। डी नेचर का मतलब उसका शेप चेंज हो जाता है। अगर उसका शेप चेंज हो गया तो वो अपना जो इंसुलिन जो है एक चाबी की तरह होता है और बॉडी का सेल एक लॉक लॉक की तरह होता है। इंसुलिन की चाबी वो लॉक में जाके उसको खोलना होता है ताकि ग्लूकोज अंदर एंटर कर सके। अगर आपका ये चाबी का शेप चेंज हो गया, अगर आपकी चाबी को आपने बहुत हीट कर दिया, उसको थोड़ा मेल्ट कर दिया और फिर उसको यूज करने की कोशिश की, तो वो काम नहीं करने वाले, वो लॉक के अंदर जाएगी नहीं, तो फिर लॉक नहीं खुलेगा। अगर आप इस चाबी को अगर प्रॉपर शेप में रखना चाहते हो, अगर इस इंसुलिन मॉलिक्यूल को शेप में मेंटेन करना चाहते हो, तो आपको बॉडी का एसिडिक कंडीशन कम करना होगा। और एसिडिक कंडीशन बहुत सारे रीजंस के कारण होता है। एक रीजन है किडनी के प्रॉब्लम से, अगर किडनी ठीक से एसिड को बाहर नहीं फेंक रही है, या तो फिर आपके लंग्स कार्बन डाइऑक्साइड को ठीक से बाहर नहीं फेंक रहे, तो इस तरह इन वजहों से भी आपका बॉडी में एसिड ज्यादा हो सकता है। ऑफ कोर्स एक और भी कारण है कि अगर आप बहुत एसिडिक फूड खा रहे हो तो वो भी है। तो आपको इन कॉजेस को ट्रीट करके आप ये इस टाइप 2 डायबिटीज के इस पर्टिकुलर रीजन को आप क्योर कर सकते हो। तीसरा टाइप है इसमें ओबेसिटी एंड फैटी लीवर। अभी हम जब भी कुछ खाते हैं तो जो भी ग्लूकोज बनता है ये सबसे पहले लिवर एब्जॉर्ब कर लेती है। बट लिवर को एब्जॉर्ब करने के लिए जो लिवर के सेल्स है, इसको दे हैव टू बी दे हैव टू हैव द स्पेस इनसाइड। नाउ इंस्टेड ऑफ हैविंग स्पेस, if they are completely loaded with fat, if the liver cells are loaded with fat, they are not able to absorb the glucose and store them. So what is required is that you need to treat this fatty liver. Now fatty liver, fat जो है वो अर्थ एलिमेंट से रिलेटेड है। अगर आप लिवर में से अर्थ एलिमेंट उसको निकालते हो तो इससे आप, और विंड एलिमेंट जो वुड एलिमेंट है इसको बढ़ाते हो, तो आप ये फैटी लिवर को क्योर कर सकते हो और इस तरह का जो डायबिटीज आपके बॉडी में बन रहा है उसको आप ठीक कर सकते हो। तो इसका जो पल्स रीडिंग होता है वो ह्यूमिडिटी इन लिवर पल्स, ऐसा दोनों साइड, या कोई भी एक साइड में ज्यादा एक साइड में कम, ऐसे भी हो सकता है। देन देर इज फोर्थ टाइप विच इज एंटीबॉडीज टू इंसुलिन इटसेल्फ। हमने टाइप 1 में देखा कि बीटा सेल को अटैक किया जा रहा है और इंसुलिन का कम प्रोडक्शन हो रहा है, वेरएस ये इस जो टाइप 2 में है वो इंसुलिन इटसेल्फ इज बीइंग अटैक्ड। तो जो इंसुलिन अटैक्ट है तो उस पे कुछ तो एंटीबॉडी जाके उस पे ज्वाइन हो रहे हैं, उसको चिपक रहे हैं। तो ये इंसुलिन जो है, ये आपके बॉडी में इंसुलिन है, लेकिन वो जैसे कि आपकी चाबी आपने ली और उस पे कुछ आपने पूरा वैक्स लगा दिया या कोई सीमेंट लगा दिया उस पे, तो वो उस तरह का वो चाबी वापस आपके लॉक में एंटर नहीं कर सकती और उसको ठीक, और वो काम नहीं करेगी। तो दिस इज लाइक दैट। अगर एंटीबॉडीज इंसुलिन को जाके अटैच हो जाते हैं तो वो इट इज लाइक आप पूरे सीमेंट के अंदर आपकी चाबी कोट होके आप उसको यूज नहीं। तो इन केस में अगेन यू विल अगेन सी इट्स एन ऑटो इम्यून डिजीज अगेन। तो अगेन यू विल सी दैट लेफ्ट स्प्लीन में आपको ड्राइनेस पल्स फील होगा, जो मैंने बताया इस तरह का फीलिंग आता है। तो ये है टोटली 10 टाइप्स ऑफ डायबिटीज, और इसको हम अष्टांग नाड़ी विद्या के थ्रू, या अगर आपके पास और कोई वे है कि आप फाइंड कर सके कि कौन से ऑर्गन में कौन सी एनर्जी है, तो आप अगर ये डायग्नोस कर सके तो आप ये 10 के 10 टाइप्स ऑफ डायबिटीज ठीक कर सकते हैं। अगर आप अष्टांग नाड़ी से वाकिफ है तो आप, इट इज बिकम्स वेरी इजी। Otherwise, you have to use other methods to determine what is the energy within every organ. So we saw that there are basically three organs in which which are mainly dealing with the subject of diabetes. One is the spleen, of course, then there is the liver, and there is the kidney. And in some cases, it can be the lung also for creating excessive acidosis. So this knowledge is enough to be able to cure any type of diabetes. And with that, I think I will, and it is not yet just one of these types. I have spoken about 10 types. हो सकता है कभी कभी इसमें के 1 या 2 टाइप्स या 3 टाइप्स भी एक साथ एक्टिव हो सकता है कि इंसुलिन डेफिशिएंसी पैनक्रियाज में भी है, हो सकता है साथ में एसिडोसिस भी है, हो सकता है कि साथ में स्ट्रेस की वजह से एड्रिनल ग्लैंड्स ज्यादा सिक्रीशन कर रहे हो ग्लूकोकॉर्टिकॉइड्स का और कॉर्टिकोस्टेरॉइड्स का तो यू हैव टू डिटरमाइन कि is it just one cause, it is 2 cause, 3 cause, or how many causes, and treat all of them simultaneously. Then you are able to get complete result. Otherwise, if you just treat one cause, you can get only a partial result. When you treat all the causes together, you see like within some time, the sugar starts going down. Type 1 diabetes में अगर beta cells बहुत completely damaged है तो उनको ट्रीट करने को थोड़ा ज्यादा टाइम लग सकता है, बट बाकी के जो टाइप्स ऑफ डायबिटीज है वो ज्यादा फास्ट रिस्पॉन्ड करते हैं. और टाइप 1 भी होता है, पेशेंट शुड हैव सम पेशेंस फॉर दैट, एंड विद इन अ कपल ऑफ मंथ्स द insulin secretion can start even in type 1 diabetes. So I think this much is enough. Dr. Jain, do you want me to say anything more, or should I invite questions?
Sir, any specific point you are selecting during your practice, sir?
So there are different 10 types of diabetes. So as I mentioned, you first diagnose which type it is. अगर ड्राइनेस एक्सेस है तो आपको स्प्लीन के मेटल पॉइंट को आपको सिडेट करना है. यू कैन यूज मैग्नेट ऑल्सो फॉर सिडेशन, यू कैन यूज needles for sedation, and you have to tonify the opposite energy and the self energy of the organ. So these are the things you have to use. You have to sedate dryness point here, you have to tonify the heat and the humidity point. So this is how this is done. अगर किडनी के केस में अगर आपको कॉर्टिकोस्टेरॉइड सिक्रेशन ज्यादा है तो आपको ह्यूमिडिटी पॉइंट ऑफ किडनी को सिडेट करना है, और किडनी के सेल्फ पॉइंट जो वाटर पॉइंट है, द कोल्डनेस पॉइंट, उसको आपको टोनिफाई करना होता है. तो और ये अगर आप इस तरह से आप अगर ये समझे तो हमें एक चीज मालूम पड़ती है कि क्यों स्प्लीन 6 सबसे ज्यादा इफेक्टिव पॉइंट रहा है अभी तक. दैट इज बिकॉज जो 3 ऑर्गन्स जो अभी हमने देखे, स्प्लीन, लिवर और किडनी, ये तीनों को एक साथ वो स्टिमुलेट करता है. तो तीनों को रेगुलेट करता है, स्टिमुलेट या सीडेट, या जो एक नीडल एक साथ बहुत सारी काम करती है. वो कहीं कोई ऑर्गन में एनर्जी भेज रही है, कहीं किसी ऑर्गन से निकाल रही है. तो अगर आप स्प्लीन 6 पे नीडल लगाते हो तो आप एक साथ सब कुछ रेगुलेट करते हो. बट इसका इफेक्ट थोड़ा स्लो और टेम्पररी हो सकता है. अगर आप प्रॉपर डायग्नोसिस के हिसाब से अगर आप जाके वो पर्टिकुलर ऑर्गन को ट्रीट कर सकते हो तो फिर आप उसको प्रॉपर क्योर कर सकते हो. सो हमने जस्ट देखे कि अलग अलग केसेस में हमने कुछ थोड़े पल्स डायग्नोसिस के केसेस देखे हैं. जैसे अब ये एक पेशेंट है, वहां पे हमने देखा कि उसके स्प्लीन में भी ड्राइनेस था, स्टमक में भी ड्राइनेस था, पेरिकार्डियम में भी ह्यूमिडिटी था. पेरिकार्डियम ह्यूमिडिटी जो है ये आपका ब्रेन पल्स में एंजाइटी का दिखाता है कि पेरिकार्डियम में आपकी एंजाइटी भी है. थोड़ा आपका ड्राइनेस जो है लेफ्ट साइड में इधर, वो आपका डिप्रेशन दिखाता है. तो ये चीजें भी डायबिटीज में काम करती है, बिकॉज इस एंजाइटी की वजह से भी ये जाके किडनी को अफेक्ट करेगा, उसमें कॉर्टिकोस्टेरॉइड्स सिक्रीशन भी होगी. ये जो ड्राइनेस जो है ये आपके ब्लड सर्कुलेशन को अफेक्ट करेगा पैनक्रियाज में. तो यहाँ पे तो डायरेक्टली हम देख रहे हैं कि ये टाइप 1 डायबिटीज है. भले ही लोग सोचते हैं बहुत बार कि टाइप 1 डायबिटीज मोस्टली बच्चों में होता है और बड़ों में मोस्टली टाइप 2 होता है, बट दिस इज जस्ट अ जनरल थिंग. You find type 1, mixture of type 1 and type 2 in a lot of diabetic patients. So, yeah. So mostly हम देख रहे हैं सब बहुत सारे केसेस बड़े लोगों में भी हम ड्राइनेस देखते हैं स्प्लीन में. Now this case you can see there is किडनी में ह्यूमिडिटी दिखा रहा है जो एंजाइटी का प्रतीक है. और इसको आप अगर ट्रीट करें, अगर आप उसके स्ट्रेस लेवल्स, अभी जरूरी नहीं है कि आप खाली नीडल से ही इलाज करें, आप मैग्नेट भी यूज कर सकते हो, आप ओवरऑल माइंड और माइंड पावर को भी यूज कर सकते हो. अगर आप देखते हो कि कोई स्ट्रेस की वजह से है तो आप उसको योगा की तरह यूज करके, योगा को यूज करके, आप मेडिटेशन को यूज करके उसका स्ट्रेस लेवल भी अगर कम करेंगे तो डायबिटीज ठीक होने वाला है उसका. अगर कॉर्टिकोस्टेरॉइड सिक्रेशन ज्यादा होने की वजह से डायबिटीज है. स्प्लीन में अगर डेफिशिएंसी है, ओवरऑल डेफिशिएंसी, तो आपको उसको बढ़ाना है. स्प्लीन डेफिशिएंसी एक मेन कॉज है. बहुत सारे लोग ब्रेकफास्ट स्किप करते हैं टोटली. एक काइंड ऑफ फैड बन चुकी है कि हम ब्रेकफास्ट नहीं खाते, हम डायरेक्ट लंच लेते हैं. तो अगर आप स्प्लीन के टाइम पे, स्प्लीन का जो वक्त है ऑर्गन क्लॉक के हिसाब से, जो मॉर्निंग में का टाइम है, उसमें अगर आप ब्रेकफास्ट नहीं करते हो तो आप स्प्लीन को वीक करते हो, तो उसकी ओवरऑल एनर्जी वीक हो जाती है और फिर वो ठीक से काम नहीं कर पाता. तो ये बहुत इंपॉर्टेंट है कि डायबिटिक लोग ब्रेकफास्ट को लेना चाहिए टाइम पे. अगर वो नहीं लेते हैं तो भले ही थोड़े टाइम उनकी शुगर कम रहे, लेकिन ओवरऑल वो स्प्लीन को डैमेज कर सकते हैं. तो हम देख सकते हैं कि कभी कभी लिवर प्रॉब्लम, लिवर में कोल्डनेस, नेक्रोसिस हुआ है लिवर में, तो उसकी वजह से भी जो ग्लूकोज लिया जाता है, प्रोस्पैंड्रियल जो शुगर टेस्ट किया जाता है, वो बहुत हाई आता है बिकॉज लिवर काम नहीं कर रहा. लिवर उसको, जो आप खा रहे हो उसको, उसके ग्लूकोज को एब्जॉर्ब नहीं कर पा रहा. तो अगर ये केस है तो आपको लिवर पे ज्यादा ध्यान देना चाहिए. समटाइम्स people always think spleen, pancreas. It is not like that. Sometimes liver is a cause of diabetes and liver has to be cured, taken care of. So I think this much presentation is okay. If any questions or any comments?
Any question, any participants? If you have any questions, please hand raise, so I will unmute yourself. So you can talk directly, Dr. Yogesh sir. So first you start your video on. Then I will.
Antim Kumar Jain sir, Doctor. See, I'm.
Yes sir. Yes sir. Ravindra sir.
Yeah, sir. You know, it is amazing. The presentation was amazing, and because hitherto what you used to treat in our own limited knowledge of acupressure, we used to find some drawbacks, lacuna. Now it has been totally clarified as the 8 energy principles, including not only 5 elements, even mind, intelligent, and ego. I mean, this how to counterbalance by reducing the excess element in these organs, and the controlling organs energy has to be increased. It's a fantastic new insight, and if possible, I request Dr. Antim Kumar Jain to kindly organize 2 days or on depending upon the timings of convenience of our Dr. Yogesh Kodkaniji's time, kindly organize, whether it is paid or otherwise, whatever it is wonderful, amazing. And as he said, we can make our country diabetes free by spreading this knowledge. It was an amazing session. Thanks to Dr. Yogesh Kodkaniji and to Antim Kumar Jain.
Thank you, sir. Sir,
I'm really glad you
here.
did.
They want to any questions, so I will unmute anyone. So I invite Samta Bhandari. Please unmute yourself.
Yes, sir. Good morning, sir.
Good morning.
So my question is, you told that right now there are 10 types of diabetes. I just want to know, doesn't they reflect in our pathological conditions when we go for tests and all the things? If nadis are going to have imbalance in that, do they affect on our pathological tests and conditions, and how can we recognize out of it then?
Yeah. So, out of the tests, what you can do is one type 1, of course, can be recognized
Yes,
by
sir.
determining the insulin level.
Yeah.
And if it is because of stress, you can also check for general corticosteroids in the blood. That levels also can be checked.
Okay.
You can also
So we
check.
have to relate cortisol levels to the diabetes also.
Yeah. So as I said, if there is excess humidity in the kidney, that leads
Huh.
to stimulates the adrenals to secrete more of corticosteroids. So if
Okay.
corticosteroids are high, if
It
you
will be difficult.
if you don't have the mechanism to check for humidity in kidney, it's fine. You can straight away consider it as excess humidity in
Okay.
kidney and treat it accordingly. And if
Okay.
there is acidosis, you have to you need to check, do a few tests, like you can see whether the vital the energy of the lungs, in the sense uh, you do the lung function test and all, see if there is the lungs are functioning properly. If they are not, you need to work on that. You can do
Okay.
pranayama, things,
Okay.
improve the lung function to reduce the acidity. And of course, acidity, if it is high in the blood, you can also treat it through proper food changes, give higher alkaline foods. And in such cases, again, lots of alkaline fruits and all are quite beneficial. So sometimes people feel that fruit should not be taken in diabetes, but these are the cases where fruits can be beneficial in diabetes. People with high acidosis. Other cases, you need specific foods. A lot of people now, again, there is a fad about not eating wheat, but wheat has got humidity energy, which is very good for spleen and pancreas. So having wheat as the first meal in the morning, during breakfast time, helps to keep the pancreas in good shape. So we have to be careful of different fads. It's all it creates a lot of trouble for a lot of people. Some people it helps, those who are having gluten intolerance. For them, of course, it's not to be taken. But the other people simply thinking that wheat is bad or something, they'll end up in problems if they do not have wheat in the morning. Does that answer your question to some degree?
थैंक यू सर, थैंक यू. सो मेनी क्वेश्चंस हियर सर. बहुत सारे लोग हैं जो डायबिटीज के बारे में आपसे बहुत कुछ जानना चाहते हैं, और जैसा कि रविंद्रा सर ने कहा, हम जब भी आपको समय होगा फिर से एक प्लेटफॉर्म पे आपके साथ डायबिटीज पर डिटेल चर्चा करेंगे. तो once on the behalf of the SVPAS and all our association, I will thank to you very much for the spreading the knowledge of the how you can cure acupressure.
Thank you so much, Dr. Antim Jain. I'm really grateful to you to give me this opportunity to present this knowledge for the welfare of the world, and especially thankful because I was able to do this presentation in presence of Dr. JP Agarwal and Dr. Lohia, if he's there now. I'm very thankful I'm able to do this presentation in the presence of these gurus, and I'm willing to help be of whatever service I can to your organization whenever and wherever you wish. Thank you so much.
Thank you very much, sir. Thank you. Thank you. Now our next speaker, I invited Dr. Cyril Antonimi. He is from Sri Lanka. So I invited to Mrs. Neeta Yavalkar. She is from SBPAS. So please introduce, sir.
Thank you, sir. Suprabhat, Namaste. Good morning, honorable guests, respected dignitaries, and inquisitive learners. I extend a warm welcome to all of you on the occasion of 3rd International Acu-Con 2024 organized by SBPAS. It's a great opportunity for all of us to enjoy this intellectual treat organized by SBPAS under its vibrant rainbow of various programs and courses created in the sky of holistic therapy. In this context, it's my immense pleasure and privilege to introduce Dr. Cyril Anthony, an accomplished scholar with various qualities and achievements in the field of acupuncture, reflexology, homeopath, alternative therapies, Reiki, philosophy, as well as in the sports field too. Dr. Anthony is the acupuncturist, president and chief instructor at Sri Lanka Taekwondo Association and the awardee of second highest civil honor and the Pride of the Nation award titled Deshmanya. From the huge ocean of Sir's achievements, let's have a glimpse of his voyage in the field of education. Dr. Anthony is qualified maintenance marine engineer, Australian postgraduate in acupuncture, Master in Laws and Human Rights UK, Diploma in Manipulating Science, Doctorate of Acupuncture, Philosophy, Martial Art, and Traditional Medicine. Sir has been practicing alternative therapies since 1994 and has achieved specialization in Panchakarma and diagnosis elements through pulse diagnosis and acupressure and has been successfully treating diabetes through acupressure. I'm very proud to inform you that being a great Reiki master, Sir had organized worldwide Reiki healing program for the trapped miners of Chile, the country of South America. Indeed, it's really a proud moment, sir. Sir's valuable contribution in the various capacities is endless. He has been the founder fellow member UK, member of the Acupuncture Foundation of Sri Lanka, member of the Homeopathic Foundation of Sri Lanka, Vice President Sri Lanka Homeopathic Medical Practitioner Association, member Serbian Acupuncture Society, member of the British Council for Complementary Therapies, former director, board member, International Council of Reflexologists, former chairperson, Education Subcommittee, ICR, member of International Council of Reflexologists, qualified teacher in reflexology, Thai massage, and Siastu therapies. Sir has been the keynote speaker for Sri Lankan massage therapy in the 7th International Conference of Medical and Cosmetic Acupuncture, Aurangabad, Maharashtra, in November 2012, reflexology and the immune system at ICR World Reflexology Week, September 2020, role of reflexologists in COVID-19 International Conference 2021, WRW, organized by JIN International Reflexology Association in September 2021, Spine Reflexology, Holistic Healthcare and Wellness Pledge Arogya Bharat by Vamsi Holistic Wellness Center in November 2021. In addition to all these, Sir's brilliance in various sports has added an extra feather in his cap as he has been the international black belt instructor and umpire in Taekwondo, Hapkido, kickboxing, and Muay Thai. I believe each of us is eager to listen to such an eminent scholar on the topic acupressure on massage therapy. Sir, kindly enlighten us with your valuable words. Thank you.
Okay, thank you very much for everybody. I give special thanks to Mr. Dr. Anthony Jain for giving opportunity for give presentation on massage therapy and acupressure. Okay. When you talk about the massage therapy, especially in the Asian country, especially in Sri Lanka, we don't get a very good name because of some unwanted things doing in massage therapies because not qualified people. That's why we like to get more people for the massage therapies to learn study in massage therapies. And I invented a new system of massage therapy for the therapeutic massage system combined with acupressure. And especially when you talk about massage therapy, we have many kind of, namely like Thai massage, Indian massage, and there's rock massage. There are many kind of massage systems. All these massage systems contain the pressure point in head and sometimes arms and the leg and the stomach area, chest area, and the back area and the leg area. And when we think about the massage therapy, and when we get a hand massage for the like the from here, shoulder to here, and palm to shoulder, like at present point. And also for the when we talk about the head massage, when you head massage, we actually we do the pressure point for the head massage. We call acupressure. We do it by acupressure for the head massage. Like especially when we have any hypertension, when we do this, we press a point here, and also we do the pressure point here, and even in low blood pressure, we put the pressure point here. That's why for the massage therapy, many people they doesn't know, but even they used to do massage therapy with the acupressure points. Some people they know what they are doing, but some they don't know what they are doing. But even that get the benefit for the people. We must admire that people are doing massage therapy because they want to do something better for the society. Some people they just do they just do just for the money, but some people they for their hobby and doing good things to the society, like other system of holistic medicine like massage also giving a very good very one of the best system in the world, the holistic medicine. Like massage, we can do even in any pain, we can massage. Even child, even boy, small child, the mother they rub their head, they're crying, they do crying, and these kind of things they do because they wanted to do some good things to the people, even to society, even to the home. And some parents, they rub their small children, even especially head, they rub their head because once they are crying, they stop the crying because they know that the mothers and fathers love go to the child. Even the small people, even like big people, when we massage, even big people, we do the same thing. Like when we massage with love, and we don't get anger. We don't put our anger to our partner or somebody we are doing massage, and that's why even much better for this is a very good source of income to some people, especially like in some countries they develop their tourism. When they develop their tourism, the massage therapy also going because many people they come to massage, especially if you go to Thailand. Thailand, very popular, the Thai massage very popular. Compared to there are people going to especially go to get, once they go there, they go for the Thai massage because they have an identity there. Thai massage, they have a good, very good identity all over the world. That's why they go there. And even we do the Thai massage, in traditional Thai massage, all the do the pressure points in the body. Even Thai massage, even shiatsu therapy also the same. And do the manipulation and also do the acupressure point. They do the acupressure point. That's why uh, uh, that's why they're very popular. Massage is very popular all over the world. And because they get a benefit, many people get benefit because if they have any body pain and they can do massage and they relieve the pain. And also some people even among the sports people, they have very good massage system called sports massage. And they have very small massage. They have any ailments or any injuries, sports injuries, they do the sports massage. And that's why massage is very popular all over the world, especially in among the sports people. They call and acupressure, combined with acupressure. Nowadays, some people they do, even physiotherapy people, they do acupuncture also. But they do some people they do the pressure point, they do the acupressure point. They put that because they get the benefit for the, it will get the benefit for the from the acupressure point. That's why many people all over the world, they like massage therapy. And some people, they think that if people want to learn massage therapy. And there are many places in the all over the world, especially Thailand, Sri Lanka, and India. There are many people, they engage this learning, teaching their massage therapies, their own massage therapies, and also they call, especially Western countries, they do the Swedish massage, they do the Swedish massage also. And combined with the acupressure, they can relieve the pain, relieve the ailments. Even for headache, we can do the head massage, and also for the even in reflexology, they do the hand therapy, they do the hand massage, and also in reflexology also they do the ear massage. You put the ear, press a point in the ear, and also the sole of the foot. And all these places, when they press in, they get a very good result for the whole body. And some people, they have in ailments, internal ailment, they can do with the acupressure with that. And also with the massage through the ailment, massage through the massage, they do the acupressure. And that's why every massage therapist should learn acupressure, then they can do a very good massage therapy and also a good acupressure points. They can do that. Then give the benefit for their clients or whatever, or the patient, whatever it is. That's why I have to tell that. Then thank you very much for giving the opportunity to me to present this time for the massage therapy and acupressure massage therapy. Thank you very much, everybody.
Thank you very much, Dr. Anthony, sir, for the explaining the scientific massage techniques. So can you explain to our participant which is the best acupressure point for the reducing the pain for the massage? My voice is audible, sir?
For the hand massage, we can start. No, even hand massage, we can start from here. Like we can start from here, the palm. We can do with this way and go this way, like that. And even for through the meridians also we can do that. especially thigh muscle also do in our meridian system. And this is scientifically proven that because they do the acupressure on our Chinese meridian system in acupuncture meridian system.
Okay, thank you, sir. Thank you. Maybe some network issue, so you are not visible in the properly. So you are explaining the different type of the massage. They call them the scientific massage, spa massage, acupressure massage, physio massage, cupping massage, and the reflexation massage. और मैं कहूँ ये जो मसाज टेक्निक्स हैं, these are our Indian techniques. और मसाज जो है
India, especially for the head massage, we do the Indian system very openly. Indian system very openly because Indian massage in head massage is very effective in Indian massage.
Thank you very much, sir, for your presentation here. Once again, thanks on the behalf of our ASVPAS Associate Institution. Thank you very much.
Okay, thank you very much.
Thank you. Now I invited to our next speaker, the renowned in the field of the Maharashtra Acupuncture Council Development, for the she lady name in the Dr. नीलिमा ठक्कर. और मैं नीलिमा ठक्कर मैम के प्रेजेंटेशन से पहले आपके परिचय के लिए आमंत्रित करता हूँ ASVPAS की ओर से दीपाली मालपानी जी को.
Thank you, sir, and very good morning to all of you, and warm welcome to all of you for the 3rd International Acu-Con 2024 organized by ASVPAS. सागर की गहराई से गहरे पानी पेट मोती ऐसा पाइया जैसे नीलम मैम. हमारे ASVPAS ने नीलम मैम जैसे मोती को ढूंढ निकाला है और उनको सुनने के लिए हम लोग यहाँ पर हैं. मैम, आप ज्ञान का अनमोल सागर हैं. आपका परिचय देना गागर में सागर भरने जैसा है, पर समय की सीमा को ध्यान में रखते हुए मुझे आपका परिचय संक्षिप्त में देना होगा. आई एम वेरी थैंकफुल कि मुझे आपका परिचय देने का मौका मिला. डॉक्टर नीलिमा एच ठक्कर मैम की सबसे पहले बात करते हैं क्वालिफिकेशन. मैम BSc हैं, उसके बाद उन्होंने डिप्लोमा इन मेडिकल लैब टेक्नोलॉजी माइक्रोबायोलॉजी मुंबई से किया हुआ है. मैम ने लाइसेंसेट ऑफ एग्जामिनेशन ऑफ होम्योपैथी, सर्टिफिकेट ऑफ ओजोन थेरेपी. बाकी बात करते हैं मैम की उपलब्धि की. तो मैम जो है वो रजिस्टर्ड एक्यूपंक्चर प्रैक्टिशनर है महाराष्ट्र काउंसिल ऑफ एक्यूपंक्चर से. मैम गाइड in teacher orientation program for prospective teacher of acupuncture college of Maharashtra, teaching acupuncture since 25 years in her institute NH integrated cure. Madam is also the core member of Association of Acupuncture Science Practitioners Mumbai. Teaching experience of homeopathy and acupuncture 25 years, and has given services in LTMG, Sion Hospital and Rajwadi Peripheral Municipal Hospital in Mumbai as honorary homeopath. Also, she was also invited in the KG Somya Medical College of Extramural Department of Mumbai University to start and run the acupuncture department to teach the students. और मैम आज जो है वो हमको बहुत ही स्पेशल जो टॉपिक है, जो आज एक बहुत बड़ी समस्या है हमारे सबके जीवन में, हाइपोथायराइडिज्म की, उसी पर मैम की जो है हमको सौभाग्य मिलेगा कि हम उनसे उस पर नॉलेज लें. थैंक यू मैम.
थैंक यू दीपाली मैम फॉर द इंट्रोडक्शन ऑफ द मैडम. और मैडम का एक छोटा सा परिचय मैं भी दे दूं अपनी तरफ से कि डॉक्टर नीलिमा ठक्कर मैडम जब भी हमें ASVPAS इंस्टीट्यूशन को कहीं कोई हेल्प चाहिए, गाइडेंस चाहिए, तो शी इज ऑल्सो अवेलेबल फॉर अस एवरी टाइम. और जितने बड़े देश के इंस्टीट्यूशंस के साथ हम तीसरी बार ये कॉन्फ्रेंस मिलके कर रहे हैं, उसमें एक्यूपंक्चर एसोसिएशन का जो रोल है उसमें मैडम ही हमारे साथ कोऑर्डिनेशन करती हैं, और मैडम के ही ब्लेसिंग से हमने पहली बार इस कॉन्फ्रेंस को स्टार्ट किया था। तो मैं मैडम का दिल से स्वागत करता हूं कि हम सबके साथ मैडम जुड़े, और आज हाइपोथायराइडिज्म जैसे सब्जेक्ट के साथ मैडम आपको इंट्रोड्यूस करेंगे। थैंक यू मैम। मैम, योर वॉइस इज नॉट ऑडिबल।
Am I audible now?
Yes, ma'am.
Okay. I am joining with two devices. Oh, one second. I'll have to manage something.
So one device.
Yeah, one second. One second.
Disconnect the audio, ma'am.
Okay. Am I okay now?
Yes, you are on. Okay, ma'am.
Am I audible now?
Yes, ma'am.
Am I audible?
Yes, ma'am. You're audible.
Okay. Actually, I can't hear you all. It's okay if as long as I am audible. So I'll share the screen of my talk and I'll ask Dr. Raymond to help me to share with my screen. One second.
Good morning, sir.
Okay. Yeah, can everybody see the screen?
Yes, ma'am.
Okay, thank you. First of all, thank you, Dipali ji and Antim ji, for a brief introduction of mine. I would straight away begin with the topic before talking further on it, that there are lots of things that ASP wants to do, and we as NH integrated cures want to do. We means myself and my husband, Dr. Raymond Thakkar. If time permits, later on, I'll go on further on that. Thanks to all the audience and participants who have enthusiastically joined SB Pass to attend this program. And it is a wonderful event happening since last 2 days. Like I have been constantly in through to listening to all the speakers over here, and they were all very wonderful. Mine is the last stop over here, and let me begin with it straight on. Okay, so I'm going to speak on thyroid today. Okay, which is really an important topic because I do weight management programs, and most of my cases who are overweight come with hypothyroidism. So I'll speak more on hypothyroidism today rather than anything else. Now, before speaking on hypothyroidism, let me uh, explain you something more on how thyroid, the anatomy, the physiology of the thyroid and thyroid hormones, how they are created in the body, and how do they act very specifically on certain things of our body and its integration in terms of acupuncture treatment. So I will go beyond on explanation a little bit about the anatomy and the physiology of thyroid gland. Now, thyroid gland is the largest endocrine gland in the human body. ये एक endocrine gland है जो a butterfly-like structure situated in your neck region. The weight of the gland in adults depends on the age, of course, your body weight, your iodine intake, many more things, but the weight is approximately 15 to 25 grams. The thyroid tissue because various sizes के होते हैं, and each follicle resembles a small sphere. I'm sure everybody knows what is a follicle. These follicles are surrounded by single layer of simple glandular epithelial cells or follicular cells. ये सेल्यूलर स्ट्रक्चर है, मैं जो डिस्क्राइब कर रही हूँ वो थायराइड ग्लैंड का सेल्यूलर स्ट्रक्चर है. हम आगे देखेंगे उसमें से थायराइड हार्मोन्स कैसे बनते हैं. Now, ये जो cells है, they become columnar, longer. जो small size round follicles है, वो columnar बनते हैं जब वो thyroid stimulating hormone TSH. सबको पता है what is T3, T4, TSH. हर एक any individual thyroid test for an individual is done with 3 parameters: T3, T4, and TSH. So these cells are stimulated by thyroid stimulating hormones, and then they pattern when resting with the stimulation. Now the interior lumen, अंदर का जो structure lumen है, जो cavity है of the follicle is filled with thick fluid called thyroid. ये पहले before getting stimulated by thyroid stimulating hormone. Now the colloid, जो colloid अंदर का जो fluid है, the colloid is synthesized by thyroid epithelium of the follicle wall. जो follicle होती है, अंदर की जो wall होती है, उसको thyroid epithelium बोलते हैं. और ये epithelium it combines with iodine. हम जो iodine लेते हैं in our food and whatever is there in our body, it combines with the iodine complex known as thyroglobulin, the precursor of thyroid hormone. Thyroid hormones are T3 and T4, और उसका जो precursor होता है thyroglobulin, वो iodine से combine होके ये hormones बनाता है, which are T3 and T4. Now there are numerous microvilli, villi like a small projections in the cells. They are called villi. From the follicular cell into the lumen, which are involved in ये जो endocytosis और hydrolysis है, वो एक physiological function है. तो ये function आप ये words पे मत जाइए. There is a physiological process happening, endocytosis and hydrolysis of thyroglobulin present inside the cell, which releases thyroid hormones. मैं बहुत simplified तरीके से आपको मैं समझाना चाह रही हूँ how are thyroid hormones released from the thyroid. Now thyroid के around में, scattered around the outside of the follicles are parafollicular cells also. There are so many cells in the thyroid which I have already explained. Columnar and small follicle types, and then how they lengthen and grow when thyroid stimulating hormones come into action with them. So the scattered around the outside of the follicles are parafollicular cells which produce a hormone calcitonin. So altogether there are 3 hormones, T3, T4, calcitonin also. Majorly over here we are concerned with T3, T4 as thyroid hormones and TSH when we are talking of hypothyroidism. Now there are 2 types of thyroid hormones which I already told you, tetraiodothyronine, and which is also known as T4, and the lesser amount of triiodo. Abhi tetraiodo mein there are 4 molecules of iodine, or triiodo mein there are 3 molecules of iodine. Now these thyroid hormones are unique in the way कि ये आयोडीन को अपने स्ट्रक्चर में यूटिलाइज करते हैं. टायरोसिन जो थायरोग्लोबुलिन में है वो आयोडीन को यूटिलाइज करके हम जो ओरल इनटेक हमारा फूड में से आयोडीन बॉडी में आता है उसको लेके ये फॉर्मेशन होता है थायराइड हॉर्मोन्स का T3 and T4 at the thyroid level. So one molecule of T4 contains 4 iodine atoms, as I told you already, and one molecule of T3 contains 3 iodine atoms. The plasma levels of T4 and T3 है. T4 का 0.4% है और T3 का 0.04% है. So T3, which is very important hormone, का कम परसेंटेज है और T4 का परसेंटेज ज्यादा है. So when you look at the blood studies, you should know that how much is the T4 level and how much is the T3 level. Now, these thyroid hormones are essential for promotion of growth and development in children. इसका काम क्या है? Growth and development and maintenance of body homeostasis by regulation of energy production and generation. Okay? तो बॉडी में हमारी बॉडी में जो एनर्जी प्रोड्यूस होती है वो इसके हिसाब से T3 and T4 के हिसाब से होती है. So what happens when T3, T4 are not in a proper homeostatic level in your thyroid? Fatigue. बहुत सिंपल है ये अंडरस्टैंड करना कि जिसको हाइपोथायरॉइड का प्रॉब्लम है, फर्स्ट एंड फॉरमोस्ट, आई विल कम टू दैट लेटर, बट अभी में ये आया है तो मैं आपको समझा रही हूँ कि द फर्स्ट एंड फॉरमोस्ट थिंग, सब क्लिनिकल लेवल पे भी आपको बहुत थकान लगती है जब आपके थायराइड हॉर्मोन्स आर नॉट इन होम्योस्टैटिक लेवल्स. Thyroid gland is unique in the way that it stores the considerable amount of the synthesized hormones. ये hormones जो बने रहते हैं वो काफी अमाउंट में स्टोर्ड रहते हैं बॉडी में, हमेशा फ्रेश बन के एक्सक्रीट नहीं होते, दे आर प्रेजेंट, and before secreting them, none of the other endocrine glands store their hormones in another form for later release. So ये बहुत ही important चीज है. T3, T4 are even stored in the body. When they are to be released, T3 and T4 detach from thyroglobulin and enter the bloodstream. On demand इसका flow रहता है. In the blood, however, they are transported by plasma proteins and circulate as hormone globulin complex. ये मैंने आपको बताया, although the thyroid gland produces more T4 than T3, T3 has got the higher affinity to thyroid hormone receptor. Now, thyroid hormone receptor is one thing which is secreted from your pituitary gland. ये axis is totally different. It is talking of the TSH. I will come to it further. Thus, the small amount of T4 that enters the target tissue and it is converted into T3 there, which is considered a principal thyroid hormone. So T3 is a principal thyroid hormone. जो भी T4 है, जब टारगेट टिश्यू में वो एंटर होता है, जहां उसकी जरूरत होती है, वहां वो अपने आप को T3 में कन्वर्ट करता है. Why I'm explaining you this is you can't be judgmental about 100% judgmental about T3 and T4 levels, because T3 level is more utilized and more useful, and T4 converts into T3 when as and when required. Now, thyroid hormones help regulate the metabolic rate of all the cells of the body, as well as the processes of the cell in cellular growth and tissue differentiations. अलग अलग टाइप के टिश्यूज होते हैं जो डिफरेंशिएटेड होते हैं बॉडी में, तो ये उसका रेगुलेशन का काम करता है. Now there are several control mechanisms of the thyroid function. हमको हमारे लेवल्स TSH के बढ़ते हैं या कम होते हैं because of the control mechanism. So there is always a balance or a homeostasis to be attained, and which is done by certain functions of the pituitary and hypothalamus. The classic hypothalamic pituitary thyroid axis, ये होता है, is the primary control mechanism in which pituitary synthesizes and release of thyroid stimulating hormone is stimulated by the release of thyrotropin releasing hormone, TRH, from the hypothalamus. इसका control mechanism, अगर excess है, T3, T4 are enough in the body. So excess of hypothalamus, which will be secreted, is controlled by anterior pituitary gland, which is not mentioned here. I'm just mentioning. TSH in turn stimulates growth and hormone secretion of the thyroid gland. ये TSH जब hypothalamus और pituitary से रिलीज होता है, ये थायराइड ग्लैंड में एक्ट करता है और थायराइड हार्मोन्स T3 एंड T4 को फॉर्मेशन एंड सेक्रीशन के लिए हेल्प करता है. Now, the secondary mechanism of thyroid function control include upregulation and downregulation of pituitary peripheral axis. ये जो मैंने आपको बताया already, TSH is controlled by the presence of T3 and T4 inadequacy or not by anterior pituitary, which is called upregulation and downregulation. कम है तो upregulation होता है, ज्यादा है तो downregulation होता है. And you all know that TSH is more in hypothyroidism. Okay, TSH level beyond 4.5 or 5 levels, depending on the patholab, उनका जो base material use होता है. So the markers are already written in all the test reports of different laboratories. Fine. So TSH level जब ज्यादा होता है उसको हम hypothyroidism कहते हैं. और TSH ज्यादा क्यों secrete होता है? Now you must have understood, because of the deficiency of T3 and T4, which are thyroid hormones and they act on our body cells as per the requirement. अगर वो कम है तो TSH को ज्यादा रिलीज कराना पड़ता है, and that is why in hypothyroidism we see TSH levels going high. Understood? I'm sure you must have understood this. So hypothyroidism is defined as inadequate peripheral tissue stimulation by thyroid hormones, जो मैंने अभी आपको समझाया. Now this deficiency is caused by either failure in adequate thyroid hormone production or reduction in tissue sensitivity for thyroid. ये यहाँ दो चीजें हैं, either thyroid hormones का production कम है या production is normal but हमारी tissue sensitivity कम हो जाती है उसके absorption के लिए और अपने आप को stimulate कराने के लिए. So there are different types of thyroid diseases, I would say, even in hypothyroid. It is preclinical, it is clinical, and further on and on. Let me not confuse you over here. Let us stick to our hypothyroidism. Now, the decreased thyroidal secretion of thyroid hormone due to the factor affecting the thyroid gland itself is called primary hypothyroidism. Decrease in serum concentration of thyroid hormone caused by inadequate TSH secretion due to the factors directly affecting the anterior pituitary gland is called secondary hypothyroidism. That means anterior pituitary का जब balancing act of counteracting on excessive secretion of TSH hormones, ये अगर काम नहीं करता है at the level of pituitary, then it is called the secondary hypothyroidism. Primary thyroidism, as I will repeat, the factors affecting the thyroid gland itself, not allowing the secretion or formation of thyroid hormone in the thyroid gland. It is primary hypothyroidism. Of hypothyroidism with onset in adulthood causes a generalized slowing down of deposition of glycoalkali aminoglycosides in the intracellular spaces, particularly in skin and muscle, producing a very clinical picture of myxedema. Now, all must be knowing what is myxedema. In hypothyroid, long-standing hypothyroid case, you will see a fatty deposition underneath your skin and underneath your muscles also, which gives a layer of very firm, non-fitting edema. Okay, so there is a deposition of glycosaminoglycans in the intracellular spaces जो mixed edema का picture बताता है. This happens in secondary, mainly in the post-clinical hypothyroidism. I will not say secondary, pre-clinical and post-clinical hypothyroidism. Now, hypothyroidism is graded on a scale ranging from grade 1, mild cases in which individual hardly notices any signs and symptoms, or the symptoms of thyroid hormone deficiency, to grade 3, which is a severe case in unregulated thyroid hormone insufficiency, and then may cause myxedema, the picture of a typical thyroid myxedema. Most symptoms of hypothyroid in adults are largely reversible with the therapy. This is where the role of acupuncture becomes very important. क्योंकि थायराइड हार्मोन एक्सटर्नली आप थायराइड हार्मोन लेते हो तो भी आपका सब क्लिनिकल पिक्चर चालू रहता है, और उस टाइम पे जब आप एक्यूपंक्चर ट्रीटमेंट ऐड करते हो यहाँ पर, we have got wonderful results with it, and that is why it is said that even along with the Western medical, I don't tell every of my patients to stop their thyroid medications. They have to take. I control and handle their, associated picture of the deficiency of thyroid hormones, where the TSH is raised. Even then, the patients start feeling so much better, more than what they are taking external thyroid hormones like thyroxine, L-droxine, whatever is available. Now let us go to the traditional medicine approach of hypothyroidism. Now, traditional medicine, here I'm talking of acupuncture. We call it in India, I want to call it a traditional acupuncture. Has several thousand years has been the treatment of choice for over a quarter of the world's population for its ailments, infections, and other health problems. Today, traditional medicine is practiced in India and other countries like China, etc., alongside with the conventional Western medicine. Now, most hospitals in Western countries have included the department of acupuncture along with endocrine department, which deals with thyroid also. So this is our aim. This should be our all together aim of all the associations here. I am being a core member, as you all know, of ASP. And we ourselves are into personal teachings from our institute, NH Integrated Cures. We deal with upgradation of acupuncture in many more diseases listed in WHO. This is, of course, at the research level. Thyroid or hypothyroid is not at the research level now, and I have been practicing it for so many years with wonderful results, even in weight management program, which is dealing with thyroid and many other things. So let us go to the etiology and pathology. The hypothyroidism as described in traditional medicine is classified mainly as a deficiency disorder in acupuncture. The diagnosis must be differentiated and often varies from case to case depending on the individual patient's clinical presentation. It is important to understand that hypothyroidism is a condition arising due to chronic deficiency of one or more vital substances of the body, which is either chi, blood, yang, yin, or essence of the body. Either or, gradually or. Because of one, the other thing, and the third thing, and the fourth thing. I will explain you still further over how the chi goes deficient, and then the blood, and then the yang, and then the yin, and all, and the treatment protocol for the same. Now, this is, of course, a systemic disorder which may start with general chi deficiency first and affect all the organ systems with the long period of disease progression. Now, the spleen, kidney, and the heart are the three primary organs involved in pathogenesis of hypothyroidism. The lung and the liver are also affected in an indirect manner. Indirect manner means, of course, if there is a disruption of the 5-element cycles, each and every organ are also indirectly affected with the main organs. We are talking of the main organs affections now. So manifestation of various deficiencies are diverse and can affect a wide variety of physiological processes. Of course, you can understand with 5-element disruptions. The precipitating cause of hypothyroidism include constitutional factors where diet becomes very important, as Dr. Yogesh was also mentioning in his diabetes presentation, overexertion, emotional stress, any kind of trauma, emotional or physical, chronic debilitating illness, any illness in the body will also affect thyroidism. For example, any illness affecting your spleen, your kidney, or your heart will definitely disrupt with its yang deficiencies, lead to thyroid problems also. And of course, a lot of side effects from the Western medical treatment. Now, the patterns of deficiencies will be differentiated by aspect of underlying deficiencies of yin, yang, chi, or blood in regards to the deficient organ or the combination of organs involved in pathogenesis. It can be either only spleen first, or it can be spleen because of the kidney yang deficiency, and then later on, in the later stage, it may go to the heart as an organ also. The clinical manifestation of hypothyroidism emerge gradually as the result of slowing down of metabolism and depletion of body's chi, developing into yang deficiency. Now, as a yang chi deficiency becomes more severe, it begins to fail into functioning of warming. You all know that the main function of the yang is warming of the system, the motivation. Okay, so all the functions will decline gradually with the deficiency of yang chi. So failing to the function of warming, motivation, transformation, resulting in the decline of multiple organ functions and classical set of symptoms often seen in the clinical hypothyroidism. The initial stage of disease is equivalent to subclinical hypothyroidism, as I was telling you earlier, and marked mainly by the spleen chi deficiency, and is often associated with the symptoms of spleen chi deficiency only at the earlier stage. As the disease remains untreated, the Ming-Man fire begins to fail to compensate spleen yang deficiency. For example, अगर यहाँ पर हमने treatment नहीं की, this is almost a preclinical stage where you feel the symptoms, but your hormone levels are not as disrupted or distorted as in a very clinical hypothyroid case. तो यहाँ पर जब spleen yang deficiency कम होती जा रही है, तो यहाँ Ming-Man fire, the kidney Ming-Man fire tries to compensate the spleen yang to come up to the level. तो ये बॉडी का नेचुरल मैकेनिज्म है होम्योस्टैटिक मैकेनिज्म है जो इनिशियल स्टेज में आपको हेल्प करता है, और तभी इसीलिए मैंने कहा कि इट इज अ वेरी बेस्ट थिंग टू ट्रीट द पेशेंट बाय एक्यूपंक्चर एट दिस स्टेज, right? Where even kidney yang or kidney essence does not go into deficiency, going to treat spleen yang to compensate spleen yang. As a result, more kidney yang deficiency symptoms arise and the spleen yang deficiency symptoms also worsen. ये जो मैंने आपको कहा, marking the stage of clinical hypothyroidism. Thus, yang deficient kidney will fail to warm the spleen yang, resulting in severe yang deficiency of both the organs. I hope you all know the patterns and the treatment by patterns, how to treat, or otherwise we will enhance further on that also if time permits. When spleen Qi is deficient, the generation of the source Qi and blood is inadequate, resulting in kidney essence deficiency, जो ये मैंने आपको बताया. It may be years before the kidney Ming-Men fire begins to fail to warm the heart yang. यहाँ पर later stage में heart का भी involvement आता है, and that is why it is very, very essential to treat hypothyroidism at an early preclinical or the clinical stage. So this will lead to heart yang deficiency. Untreated yang deficiencies will result in the failure of fluid metabolism. ये आपको पता है that spleen main function is transferring and TNT function and transportation function of the fluid metabolism. So fluid metabolism का जब failure होता है, it will cause in excess water to overflow towards the heart and lead to cardiac dysfunction and associated symptoms commonly seen in the patient with over advanced stage of hypothyroidism. Thus, the severe yang deficiency will result in complete depletion and devastation of Ming-Men fire, which will manifest as number of life-threatening functional failures. Note that the kidney yang and Ming-Men fire refers to the fire at the gate of vitality. Now, what are the factors contributing to the disease? Common contributing factors of thyroid deficiency, as I mentioned, include improper diet, the external or the iatrogenic factors, and constitutional factors and overexertion mainly. There are different pathological causes also, but these are the contributing factors which we can avoid, which we should avoid. Now, irregular dietary intake, that is excessive consumption of raw and cold food, will injure spleen yang qi. Chronic iodine and selenium deficiency. Remember, zinc and selenium are the main minerals which act in the formation of thyroid hormone along with iodine. So it will also contribute to the rise of hypothyroid state. So the deficiency of iodine, selenium, and zinc will also rise to the hypothyroid deficiency stage. Previously believed it to be the evil chi, and the sand in the water of springs and rivers also are called the evil chi. So adulterated water also leads to the thyroid problems. Now, iatrogenic factors mean the long-term use of unusually high dose of bitter and cold herbs or emetics or purgatives have direct impact on the spleen and stomach yang qi and may impair the functions of transportation and transformation of food and fluids. There are some constitutional factors, congenital deficiencies, prenatal malnourishment may play into development of thyroid deficiency. In women, the depletion of essence and blood from repeated childbirths will directly drain the kidney, qi, essence, and also of the liver and spleen qi. Overexertion, overtaxation, and exhaustion of kidney yang by physical, mental, or sexual activities is one of the very important contributing factors for hypothyroidism. It is apparent that hypothyroidism is a result of both Qi and blood deficiency, which gradually develops into Yang and eventually into Yin deficiency. Now, the clinical picture, like most other endocrine disorders, hypothyroidism develops gradually over the period of several years or decades. Many symptoms can erroneously be attributed to general environment factor or natural aging. This also leads to reduced secretion of hormones in your thyroid gland. And that is why your TSH has to act more, work more, and it rises. Patients often seek medical help when the symptoms begin to interfere only in their daily activities or it is ignored. Usually 60 to 70% of the females are more affected than males with the thyroid gland, with hypothyroidism. Even though the symptoms of hypothyroidism come in great variety, they all arise from four pathogenesis. Again, I will repeat of yang qi, that is failing to warm, defend, consolidate, and transform the energy. The core symptoms, as I was mentioning, fatigue, weakness, there can be tingling of the fingers, there can be severe constipation, there can be menorrhagia, metrorrhagia, or irregular periods. These are all the very common symptoms of hypothyroidism. So, also importantly, the spleen chi will begin with the weaknesses of the legs first. The leg chi and the atrophic disorders may arise as a result of either dampness or chronic spleen deficiency. The first and foremost symptom of chronic spleen deficiency that it will affect your leg cheese first. So the first symptom when you start feeling that you're feeling weak with your legs and you're not able to walk enough, there are pains in both your legs, you have to think of hypothyroidism. And importantly, see how this traditional acupuncture, we have got the earth point of stomach meridian, which is called uh, Suzanne, of course, but it means leg chi, 3 miles. So when you give the earth point of stomach meridian, you start walking and your spleen chi also starts improving with that. So this is the most important point. I'll come to that further for hypothyroidism. With exposure to dampness over the period of time, the muscles and the flesh will be invaded, and this will lead to insensitivity and the atrophy, the degeneration, the atrophy of the flesh of your legs. When there is illness in the spleen, it fails to transport body fluids to the stomach. Now, the four limbs do not receive the nourishment of water and grain, the food that means, and therefore they start feeling weak. They become weak. There is no free flow through the vessel pathways, and there is no chi to engender the sinews, the bones, and the muscles, which therefore cannot function. And when it comes to the sinews and the bone and the muscles, you must have realized that at a later age, you start getting ankle pains, you start getting joint pains, etc., which can be because of clinical or preclinical hypothyroidism. The spleen chi deficiency will also lead to development of such symptoms as decreased appetite also, because the stomach chi also gets affected. Alongside, you can start feeling the muscle weakness. You can have the delayed reflex time because of the deposition of the colloid tissues in to your cells and in between the muscles and the cells. There is distension and bloating, especially in the later stage of the disease. And of course, the chronic spleen deficiency will cause blood deficiency and anemia. and lead to chi stagnation, leading to muscle spasm, cramps, myalgia, and even ataxia, that is the improper gait. Right? So all these are related to spleen chi deficiency. Of course, irregular menstruation and menorrhagia, which I've already explained to you earlier. Now, hypothyroidism is much more common in women and men than men and often disturb women's menstruation. Chi is one manifestation of essence. The patency of liver chi is important to help the spleen chi function as well. Severe chi and blood deficiency in hypothyroid women often disrupts the circulation of liver chi and even the chong mai, and this is why you go into menstrual difficulties with irregularities and menorrhagias. In men with hypothyroid, chronic kidney yang chi and consequent deficiency of essence may manifest into impotence and infertility. So again, many patients with progressive hypothyroidism present with heart and kidney deficiency leading to Shen disturbances and lead to depressive state of mind, reduced attention span, memory deficit, slowed reaction, your voice goes husky, there can be vertigo also. So let us go to the major TCM patterns here, which affect, which I have already mentioned, after which we will go to the treatment aspect with the patterns. Spleen chi deficiency, the early stage of subclinical hypothyroidism is associated with spleen chi deficiency, which if untreated will develop into more of a spleen yang deficiency, which further will affect the functions of all remaining organs. I'm repeating this. Now, all the general symptoms of spleen chi deficiency, which I've already mentioned, the common symptoms like even shortness of breath, slow and occasional slurred speech, husky voice, dusky complexions, reduced appetite, and weak pulse, which is also important. There can be either loose stools or constipation depending on the stage. Now, again, the second pattern being spleen yang deficiency. It controls spleen and stomach control, the transformation of the nutrients and plays the essential role in regulating ascension and discretion of the chi. In clinical hypothyroidism, yang chi of middle jiao goes weak and the patient may suffer an invasion of external cold, which may hinder the normal chi flow and result in epigastric and abdominal distension or even pain. So this can be a rare symptom, but you should know what spleen yang deficiency does. The cold sets in into the middle jiao, which leading to distension, bloating, indigestion type with the hindrance of normal chi flow, and it also results in epigastric and abdominal pain. Now, spleen yang deficiency is also characterized by intolerance and aversion to cold in a later stage. The aversion of cold also will set into hypothyroid symptoms. Cold extremities, pallor, fatigue of cold type, and of course, I mentioned the pain and constipation earlier, and also excessive thin white leukorrhea in women. The tongue is usually flabby and pale with teeth marks here and white and slippery coating. The pulse is deep, slow, and forceless or faint into with severe thyroid deficiency. Now, chi and blood deficiency. Yes. Blood deficiency, we come to chi and blood deficiency. As you all know, chi is the commander of blood and blood is the mother of chi. Chi and blood are mutually connected. When chi moves, the blood follows. Blood, in turn, nourishes the chi, and thus tonifying one will have the indirect effect on the other. Low blood cells count and hypoxia, lack of oxygen, are clinical manifestation of chronic hypothyroidism, and that is why you feel you are breathless because of all this low blood cell, and leading to lack of oxygen in your blood cells will lead to little hypoxic state where you start feeling breathless or moment. Hypothyroidism associated with chi and blood deficiency, which is of course marked, you all know, fatigue, weakness, slowness. There can be palpitation to compensate this, and a shallow compression with pale tongue and a choppy pulse. Menorrhagia, we have already described that the affection, the functional system of liver and trauma and uterus are affected because of this. If the liver blood is deficient, it is unable to rise and nourish the head, resulting in dizziness and vertigo and even impairment of vision. When the sea of blood is empty, the menstrual cycle is typical irregular with a scanty flow. However, when the blood becomes disordered, menorrhagia may occur. The tongue is usually pale here, pulse is thin and wiry, choppy, and may be felt in the condition of blood stasis. Now let us go to spleen and kidney yang deficiencies together. Difference between the deficient cold and external excess. Cold due to yang deficiency may be elevated by simply wearing more clothing, where cold sensation and chills associated with exterior pathogen cannot even be reduced by increasing the room temperature. So this is the difference. The normal cold of yang deficiency may reduce by simply wearing warm clothing. But here, the cold sensation and the chills associated with the external pathogen cannot reduce even by increasing the room temperature. So there is a lot of internal chill and tremor. The symptoms like lassitude, lethargy, withdrawal into oneself, aversion to cold, cold extremities, these are all the symptoms of kidney yang deficiency. Okay? With pain in the lower back, pain in the knees, flabby tongue, white, moist coating, deep, slow, and forceless pulse. Of course, in the right proximal position. Seen in severe clinical hypothyroidism are some of the common manifestations of spleen and kidney yang deficiencies together. Now we go to heart and kidney yang deficiency. Kidney is the root of body's yang qi, which supports the generative and the transforming process of all the organs. So chronic kidney yang deficiency will lead to spleen yang deficiency. Water and dampness accumulate in the late stage of hypothyroidism will impair the yang qi from ascending and clear the descending of the turbid of the body, the waste of the body, which may obstruct, the turbid may obstruct the sensory orifices. Thus, overtly, hypothyroid patients often complain of impaired hearing, heavy sensation in the head, dizziness ranging from lightheadedness and positional vertigo. Okay, and also reverse peripheral frigidity to warm the middle jiao to transform turbidity is very importantly to be done here. And we'll come to the treatment of hypothyroidism, which can be done by acupuncture, moxibustion, and even use of cupping at times will help. Hypothyroid patients are definitely not often deficient in yang and qi. So long needle retention or strong acupuncture stimulation may further drain the qi. So never do that in the patients. Tonification techniques are highly advised and used. Importantly, moxibustion and pressure are also encouraged. Moxibustion is very well applicable here for the warming function of the point. It is important to keep in mind that as a general rule, back shoe points tonify the gland organs and also regulate the poo organs. So, moxibustion act on the back shoe points are very important here, and even to regulate the poo organs. Now, while front new points sedate the poo and regulate the gland. So, the application of moxibustion at very precisely becomes very important here. So, importantly, this sentence says that moxibustion on REM 6 and 4 to supplement yang is very, very useful here, because when yang grows, even the yin is lengthened and it grows. So let me mention the key point of treatment protocol here. Most importantly, U4, the Ming man, where there is severe dizziness even on lying down in hypothyroid patients. The patient also feels weak here with instability of posture, which sometimes require a conscious effort to maintain. These are the symptoms of the affection of the Ming men fire here in hypothyroid. The second important point is red 4, your on, which is a gate of origin point and the crossing point of conception vessel with spleen, liver, and kidney, all the three. So this point becomes very important to regulate the spleen yang, the kidney yang, and even the liver stagnation. Yeah. So even moxibustion or needling in this area, but the needling at the with the tonification method. Now, of course, I mentioned REM 6 also, which is 1.5 foot below REM 8, and you can do moxibustion or needling in that region. I have already mentioned stomach 36, which is the hazy and the earth point of stomach meridian, which is also called three-leg mind, Suzanne. It is the yang Ming meridian of foot, which gives immense energy to the whole body. Let me mention over here that the yang Ming point, the yang Ming channels, the yang Ming of the hand and the yang Ming channel of the foot, both are, there is a research happening with the yang Ming channels of hand and foot over the treatment of Hashimoto's thyroid problems or even thyroid cancer. The research is not complete. Even I am putting in my mind as a research protocol for such type of patients when I get. So again, Kanjiao, spleen 6. It is the 3-yin intersection point of spleen, liver, and kidney meridian, becoming very useful. Needling on this point is very helpful. Then UB17, which is a diaphragm shoe point. Now, why you have to use the diaphragm shoe point? To give energy to the middle GIO, which is most affected by the affection of spleen and stomach yang chi. So, the chi of the diaphragm shoe also is infused to the back, and indirectly the kidney yang is also tonified with this point. So UB17 becomes again an important point. Not very deep needling is required here because there is a gathering of blood there. UB23, which is Shen shoe, of course, you all know it is a kidney shoe point and a back shoe point of kidney, and how and why it becomes very important to treat that point. Li4, the heavy, usually given with stomach 36. It is the point of the yang Ming channel of hand. Again, and as I was telling you, yang Ming channel of hand and foot are the most important channels to treat any type of thyroid disorders. I have already mentioned the research protocol of Hashimoto's thyroid disease by using the yang Ming channels of hand and foot, showing very good positive results in controlling hypothyroidism. Now, the inner gate T6, which is the new connecting point of pericardium channel, which becomes very, very much more useful in the later stage of the heart or the cardiac involvement in the stage of hypothyroidism. Let us go to some more supplementary points for the various patterns we have seen. For spleen Qi deficiency and spleen Yang deficiency, both clinical and subclinical, you can add Ren12, Zongwan. In Qi and blood deficiencies in chronic clinical hypothyroidism with cognitive and psycho-emotional deficiencies, you can add even DU20. You can add DU20 even in case of liver Qi stagnation leading to vertigo and dizziness in the patients and also due to lack of Mingman file. For spleen and kidney Yang deficiency, that is chronic clinical hypothyroidism with stiffening sensation. Of course, I have mentioned REN 17, REN 12 earlier also, and when there is a stuck feeling in the chest, the stiffening sensation in the chest because of, I was mentioning why hypoxia and why shortness of breath. In this case, we can add even REN 17 along with REN 12. In heart and kidney Yang deficiency, that is overt excessive hypothyroidism, use REN 17, which I have told. Addition to the guest host combination of Thyroid, spleen 3, and stomach 40, and the Leo gas to resolve phlegm. When there is too much of colloid or a mucus collection in myxedema state, which is collected underneath your within your cells and in between the cells and the muscles, you can use stomach 40 Femlong, which is the Leo, and the most important phlegm resolving point. Movement of the phlegm is done by stomach 40 due to the spleen deficiency. This point can also be used to treat pleural and pericardial effusions in the later stage, which would lead to coronary artery disease and hyperlipidemia. So this point is also used in hyperlipidemia, which occasionally comes along with hypothyroidism also. Okay, and even in the cases of goiter, which comes simultaneously later. In depletion and devastation or the collapse of Yang Qi, which is called the myxedema crisis, REN 17 and DU20 come into play immediately. For abandonment disorder, that is myxedema, DU20 again with DU26. You have to immediately puncture DU26, which is Renzong, to resuscitate the patient with acute syncope with myxedema crisis and coma due to hypothyroidism. Most hypothyroid patients become comatose, where the respiration slows down very much or fails. It is important to keep the patient conscious until the paramedics arrive. Now, of course, you all know that hypothyroidism is a condition of underactive thyroid gland, which does not produce thyroid hormones properly, and there is lack of energy. There are certain additional points like governing GV7. It is effective both in men and women, and it is called the central pivot point, which is again very useful at the center of the body, back affecting the middle GO. Stimulating this point helps in bring up the yang energy, which is beneficial for hormonal function. It is, of course, also a local point for back pain, which comes due to kidney yang deficiency. You start feeling of low back pain, not very excruciating type, but फुट बैक जब थक जाती है, थकान का जैसा बैक पेन आपको फील होता है, तभी ये पॉइंट बहुत यूजफुल होता है. Of course, kidney 7, which is another point. Now, this point is one of the most functional thyroid point. It is beneficial for the treatment of hypothyroid, being a yin river and the metal point and the sea of G. It will continue the flow of fluid, and of course, being the metal point, it will of kidney, it will also help the kidney point as a mother-son-law. This point is also termed as recovery flow point. You know, the circulation of leg chi. It will help in recovery flow. Of course, you all know where it is situated. Just to put about the taxi point, kidney 3 point. You can see the location of both the points, in G and kidney 7. Awake spleen 8 is another important point. It is a Z-clef point and favorable for the treatment of digestive disorders, even the bleeding disorders, immunity out. Any type of bleeding, the Z-clef point, that is a spleen 8 point, it becomes very useful in acute emergencies where there is a lot of weakness, numbness, and pain in legs because of hypothyroidism. Of course, you all know the location. It is located 3 foot below the medial condyle of tibia. Yin tan. This is also a very good point. One of the extra points that do not correspond to any specific acupuncture meridian. But this point is located between the 2 eyebrows, just below the area known as third eye. Stimulating this point helps in tonifying the blood and chi for better functioning of thyroid gland. तो फीमेल्स को टीका हमेशा लगाए रखना बहुत जरूरी है. It is of course also a reflex point of pituitary gland which controls the thyroid gland. The yin tan is also a significant point for calming the spirit and treating insomnia, stress, and anxiety, and also a local point for treating headache and congestion in sinus. So here is the location of yin tan. One more point is Li11, again the Yang-Ming channel of hand. It is a powerful point, yin well in the middle point of Yang-Ming meridian. This point is termed as the pool of the band, and it is situated, of course, at the lateral edge of the elbow freeze. Stimulating this point clears the heat and cools the blood and regulates chi and blood. This point is also used to treat many other indications are there, along with the indications of thyroid, like the stiffness of muscle pains like shoulder pain or knee pain or any other abdominal pain related to hypothyroid. You can use this point. And this is again a very important point for depressive psychosis due to hypothyroidism. Okay, so this is the location of Li4, Li10, Li11. Now, the last slide before I end, and I give it, since Dr. Hemant is here, let us take advantage of him to express some more things on the patterns related to this. I would just say that we could look upon kidney yin as the foundation of yin energy in the body, in particular of that of liver, heart, lung, and kidney yang as a foundation of yang energies of the body, in particular that of spleen, lung, and heart. Kidney yin is a fundamental substance for birth, growth, and reproduction, while kidney yang is the motive force of all physiological processes of the body. Kidney yin is a material foundation for kidney yang, and kidney yang is the exterior manifestation of kidney yin. Very, very important message over here for all the acupuncturists from this slide. The kidney yin is the material foundation of kidney yang, and kidney yang is the exterior manifestation of kidney yin. So you all know, or Dr. Hemant can brief you. Before I hand over to him, let me tell you that along with acupuncture, moxa, cupping, We can even use the point of auricular acupuncture, which can, the needle can remain there, and it can stimulate the thyroid for hypofunctioning. Continuously, there are points like endocrines and neural points and many other points which will come behind.
गुड आफ्टरनून एवरीबॉडी। कल डॉक्टर अंतिम जैन ने कहा सबको वेलकम करो और एनकरेज करो, और आज का सजेशन है उनको थोड़ा और ज्यादा मोटिवेट करो। सो आई एम हियर टू हेल्प यू ऑल। हम क्या करते हैं, आर यू एबल टू हियर मी?
यस सर।
ऑलराइट, see, fundamentally what we are talking about is basically the chi. Okay, now fundamentally we are talking about the chi in terms of two things. All right, what is that? Prenatal chi and postnatal chi. प्री मतलब पैदा होने से पहले, और पोस्ट मतलब पैदा होने के बाद। मतलब क्या हुआ, ये जो ची है वो हमारे पेरेंट्स ने हमको दी है एट द टाइम ऑफ कंसेप्शन, और ये जो पोस्ट नेटल ची है वो है हमारे पैदा होने के बाद हमने जो खाना पीना लिया उसकी वजह से जो ची बनी वो। एक फंडा क्लियर हो गया। अब हम दूसरी बात पे आते हैं। प्रीनेटल ची, दैट मीन्स किडनी। पोस्ट नेटल ची यानी के स्टमक, स्प्लीन, एंड टू सर्टेन एक्सटेंट लंग। अर्थात हमको जो ऑक्सीजन या प्योर एनर्जी इन टर्म्स ऑफ एयर से मिलती है दैट इज रिलेटेड टू लंग, एंड हम जो खाना पीना लेते हैं दैट इज रिलेटेड टू स्टमक एंड स्प्लीन। और आज का ये जो टॉपिक है थायराइड का, उसका लेना देना किससे है? मेटाबॉलिज्म, राइट। अभी उसका कंसर्न किससे है? डाइजेस्टिव सिस्टम। उसका कंसर्न किससे है? स्टमक एंड स्प्लीन। नाउ डू यू अंडरस्टैंड के सारी चीजें घूम फिर के स्टमक और स्प्लीन अथवा तो स्प्लीन की जो भी पैटर्न्स है उसके ऊपर आकर के क्यों रुकती है? उसका आगे कंसर्न किडनी से भी होता है कहीं कहीं, और हार्ट से भी होता है कहीं कहीं। When the person has relative problem in terms of infertility or amenorrhea, dysmenorrhea, अगर डिस्मेनोरिया है तो लीवर का भी रोल आ जाएगा, लेकिन फंडामेंटली हम लोग बात करेंगे स्टमक एंड स्प्लीन की। अब हम फिर से आते हैं, किडनी इज द रूट एंड द ओरिजिन फॉर द यांग एंड द यिन ऑफ द बॉडी। अब यांग एंड यिन ऑफ द बॉडी में अभी लास्ट स्लाइड में आपने देखा कि मोस्ट इंपॉर्टेंट क्या था? यिन में लीवर इज द फर्स्ट वन टू गेट अफेक्टेड, whereas in case of yang the spleen is the first one to get affected, and all the thyroid related problems are majorly related to spleen। तो हमको फोकस स्प्लीन पे करना है। और जब बात चली थी ची और ब्लड की, तो डॉक्टर नीलिमा ने आपको समझाया ची इज द कमांडर ऑफ ब्लड एंड द ब्लड इज द मदर ऑफ ची। अर्थात स्प्लीन जब तक न्यूट्रिशन हमारे खाने से जो चूसेगा उसका उपयोग करेगा ब्लड बनाने में. सो स्प्लीन is the root and the most important one for production of the blood, और उसी तरह से for spleen. लेकिन ब्लड की मूवमेंट के लिए क्या जरूरी है? ची. और ची प्रोडक्शन के लिए क्या जरूरी है? ब्लड. सो फंडा क्लियर हो गया सबको कि हम लीवर की भी बात करते हैं, हार्ट की भी बात करते हैं और कभी किडनी की भी बात करते हैं जब हम थायराइड के बारे में बात करते हैं. लेकिन मेनली हमारा फोकस कॉमन जो हमारे पास केसेस आएंगे उसके लिए हमको बात करनी होगी स्प्लीन के बारे में. फंडा क्लियर हो गया सबको? So this slide very clearly tells you what we talked about already so far. All right. Now we are going to the next. All right. And that tells us that what are the fundamental functions of spleen. It governs the TNT. All right. It governs ट्रांसफॉर्मेशन एंड ट्रांसपोर्टेशन, अर्थात प्रोडक्शन भी है, चेंजिंग भी करना है और एक जगह से दूसरी जगह ले जाना भी है. इट कंट्रोल्स द ब्लड विद इन द वेसल्स, यानी कि जब भी मेनोरेजिया होगा तो आपको स्प्लीन पे ध्यान देना होगा. अब अगर 4 लिम्स, ये जो बात हो रही थी कि लेक ऑफ न्यूट्रिशन, because of that the lower limbs are lowly nourished and that is what can cause the lack of strength. तो यहाँ हमको बात करना है, it controls 4 limbs and it opens into the mouth and it controls the rising of the chi. At the same time tension के साथ भी उसका लेना देना है. So more the person is thinking too much, one will suffer. Now we are talking about the basic symptoms of spleen chi deficiency. ये मैनिफेस्टेशन डॉक्टर नीलिमा ने आपसे ऑलरेडी कहा है और आप स्लाइड पे देख सकते हैं. या एडिशनल इंफॉर्मेशन आपके पास क्या है कि टंग कैसी होगी. ओके, एंड दैट इज in chronic cases the sides will be swollen and sometimes with severe cracks. Now that goes very important. And the pulse, if you are feeling, it will be little empty kind. अब हम आते हैं बेसिकली की सिम्टम्स पे. तो की सिम्टम्स क्या है? पुअर एपेटाइट, tiredness and loose stool. ये 3 चीजें. And you can think about spleen chi is deficient. And in that case, you need to understand what is the reason behind it. The reason is excessive consumption of cold and raw food. The spleen action of TNT gets affected. Why? Because spleen chi is deficient. अब आगे चलते हैं. Eating at irregular times या excessive eating also will have the same impact, or eating too little or eating and immediately going to work also has the same impact. So the treatment principle for this is tonify the spleen chi. अभी जब tonify करना है अर्थात all points reinforce करना है. So these are the points you will use. You can take the picture of the slide, okay, so that you know which points to use. और सबका पर्पस chi को tonify करना है. अब दूसरा ऑप्शन है या दूसरा पॉसिबिलिटी है स्प्लीन यांग डेफिशिएंसी की, जिसमें सिम्टम्स हैं lack of appetite, abdominal distension, tiredness, shallow or bright complexion. Now remember and understand, ची अगर deficient है तो tiredness तो होना ही है, yang deficient है तो भी होना है. तो difference क्या होगा? When yang is affected, the cold part comes into the play. जब ची नहीं थी या ची कम थी तो टायर्डनेस प्रीडोमिनेंट होगा, और जब कोल्डनेस ऐड हो गया तो इसका अर्थघटन करना है yang is deficient, because chi or yang, they are also parallel. Now tongue will be pale, swollen and wet, right? And the key symptoms are loose stools, tiredness, chilliness and cold limbs. So अब हम आते हैं ये spleen chi deficiency के साथ additional symptoms of chilliness, what I already mentioned to you. This is also described already, because the accumulation of fluid will take place. Why? Because the yang is deficient. So when yang is deficient, it will not easily move. Okay? So that is where the fluid gets collected. So etiology, again related to eating, as you see. Again, the treatment principle will be tonify and warm the spleen yang. All right. These are the points. You can take the picture, and the purpose is to tonify the spleen and the yang of spleen. So done. Thank you, everyone.
These are the points of auricular acupuncture.
These are the points of auricular acupuncture, what you can utilize. All right. You can take the picture because the time is short. I will not go in elaboration of those. Right? All right. Thank you very much. Thank you, Antim ji.
Thank you, sir. And thank you very much, madam, for the nicely explained symptom and sign of the TCM pattern related to hypothyroidism. Maybe you are all enjoying this session. So if you have any questions, please hand raise. अगर आप में से किसी का कोई क्वेश्चन हो तो आप हैंड राइज कर सकते हैं, मैं आपको अनम्यूट करूंगा.
Yeah, or otherwise we can always discuss it in the group later on also, अगर किसी को थोड़ा सा बाद में सूझता है. Any queries related to this topic, you can always come back to us anytime.
Okay, I invite to Chaya ji, please unmute yourself.
Can you, sir, can you hear me, sir?
Yes, we can.
Any point, one master point, which will help us to balance the TSH level? Any particular point which can be stimulated on a daily basis, which can help to balance the TSH level?
DU20.
GB21
and GB21.
good for endocrines.
Yeah.
Okay.
GB21 is a good point for endocrine, but most importantly, when it comes to pituitary, thyroid axis and hypothalamus, DU20 is comes into play.
Meetu ji.
All right, Chaya?
Yeah. Meetu ji.
Great session, ma'am. I want to know, ma'am, hypothyroid occurs in men also?
Yes, it does. But very less percentage, more in females than in male. Because most of the times, many a times, physical exertion is more in females.
Yes, ma'am.
taxation of the body is more in females. Even the diet protocols are not followed properly in males, and that is why this is a general consensus or statistics that females suffer more. Maybe they are having lack of kidney essence because of the they are going into depletion of kidney essence because of their menstrual cycles and the constitution.
Okay.
So females suffer more from hypothyroidism than males.
थैंक यू मैम, थैंक यू वेरी मच मैम फॉर द नाइसली एक्सप्लेन। मुझे लगता है कि जितने हमारे यहाँ साथी जुड़े हैं एंड हु इज प्रैक्टिसिंग एक्यूप्रेशर, एक्यूपंक्चर और सुजोग, दे हैव यूज्ड दिस ऑल प्रोटोकॉल्स और उन्हें बहुत बेनिफिट्स मिलेगा। तो मैं एक बार हम सबकी ओर से फिर से धन्यवाद देता हूँ डॉक्टर नीलिमा ठक्कर मैम का, डॉक्टर हेमंत ठक्कर सर का। और मुझे लगता है कि इस सेशन की शायद डिमांड बहुत ज्यादा है और फिर से इस सेशंस को हम डीपली करेंगे, क्योंकि सर ने साइंस, सिम्टम्स और सबसे अच्छी बात है कि जो चाइनीज एक्यूपंक्चर में डिफरेंट पैटर्न्स होते हैं उनको भी मैडम ने बहुत अच्छे से एक्सप्लेन किया और आगे ये सारे पॉइंट्स आपको बहुत हेल्प करेंगे। तो मैं ओवर करता हूँ, आज के पूरे सेशन को समराइज करने के लिए मैं इन्वाइट करता हूँ श्री एम वी रविंद्र सर।
Thank you, Antimji. Yet another enthralling, captivating session has happened today. Thanks to all the contributors. Mainly, it was started with our beloved President, Dr. Alok Dwivedi ji. He has ignited the proceedings with a beautiful slogan, Shraddhavan Labate Gnanam. And then he has told that Ayurvedic acupressure is the foundation of all science to maintain health and prosperity. What a beautiful, start he has ignited. Then our Sakshi madam, as usual, beautiful, rendering of prayer. Not only that, introduction of SB pass in a precise manner, and it was really very nice. One more thing I would like to add here, that all the introducers, who are narrated, like, whether it is Dr. Manish Sharma ji, Professor Lakshman Krishnamurthy, Mrs. Neeta Yawalkar ji, Mrs. Deepali ji, all of them, they did their job aptly. One thing I had noticed, that all of them are highly potential. In the days to come, in our next conferences, they can present papers. They're so potential. And I should thank our beloved president of ASPES, Professor. He's more than a professor or more than a doctor. That is J.P. Agarwal. Is a really legendary figure who has explained in his greetings the essence of MNIM, which is gaining ground day by day through all his students and followers, because the efficacy of MNIM is really where I'm experiencing. It is fantastic because it contains only three points in each meridian, user friendly. Okay, and then we come to the scientific session one by Dr. Yogesh Kodkani. It was out of the world, I should say, because so in the simplest possible manner he has explained the new concept, hitherto unknown. See, I did not know that there are 6 causes in diabetic mellitus 1, which can even treat juvenile diabetes. And then in the diabetes 2, there are 4 patterns, which what are the causes, which organ has to be toned or sedated, how to balance. That has explained beautifully. But I really I request him to kindly share if any printed material is available, so that we can spread it and conduct courses. So it is going to help our country to a great extent, because India is supposed to be the capital of diabetes in the days to come. But we can really, here is a hope through Dr. Yogesh Kodkani ji to combat it, fight it out. I'm sure we have a beautiful, hope has been given, and I'm sure it will be implemented by all serious students of acupressure to benefit our fellow beings in our country. Then Dr. Nilima Thakurji has, before that, I had to thank Dr. Cyril Anthony for he has expressed the benefits of physiotherapy and added one word that it is compulsory for physiotherapists to learn acupuncture or acupressure to enhance their capacity. A wonderful suggestion. I thank him for that. And then we come to Dr. Nilima Thakurji, because another very important topic like diabetes. Most common disease is thyroid and BP and sugar, diabetes. And she has also beautifully explained right from physiology and what is the role of T3, T4, what is iodine, how 3 iodine fused together become T3, 4 fused together T4, what is the role of thyroglobulin, how they release thyroid hormone. Everything was beautifully explained. More than that, what is the function, role of thyroid, how it controls growth, homeostasis, equilibrium, energy in the body, water metabolism, everything has been explained beautifully. And more than that, she has connected it to the hormones. How thyroid is directly, its master gland is pituitary gland. Master is hypothalamus gland. We have to treat that also. And role of water metabolism in treating hypothyroidism was beautifully explained with protocols. See, in the limited time, if I really feel that our beloved Antim Kumar Jain, you can, sir, I request you to arrange a full-fledged classes on by these two experts, so that our, all acupressure therapists will benefit. Not only benefit for them, it is benefit for the society also. It was in a very, very useful session. And every, the role of Dr. Hemant Thakur sir has also added, value for the contribution by Dr. Nilima by explaining the role of prenatal and postnatal energy and explain the entire protocol in a nutshell. It was really, and some news site has been given in the role of Mingmen Fire, which is located at GV4, and some important, explanation on some of the protocols has been given. Hitherto, not in practice, not in vogue. It was very, very, very useful for everyone. I once again, thank all the participants to, the conference was so beautiful. It will be green in our memories for a long time to come. And the backbone and the brain behind this is definitely our beloved Dr. Antim Kumar Jain. For him also, I extend my congratulations and thanks, and hand over back the session to Dr. Antim Kumar Jain for closing ceremony. Thank you.
Thank you, sir, for the concluding the session. Thank you very much. I will vote out the thanks to our all associate institution, especially in the ISP, Indian Academy of Acupuncture Science, International Naturopathy Organization, Tiger Youth Club, Ishan Bangalore, and SB and all SB and Ishan team. They are supporting us, especially thanks to our speakers. They are joining us. A special, very, very thanks to our participation who are joining for the every time for our conferences. तो मैं अपनी ओर से जितने भी हमारे प्रतिभागी जो जुड़े हैं देश विदेश से, उन सभी का धन्यवाद देता हूं। और फिर हम अगले सेशंस में कुछ दिनों के बाद आपके साथ मिलेंगे। और आपसे रिक्वेस्ट है एसवी पास के यूट्यूब चैनल को आप सब्सक्राइब करके रखें, ताकि हम आपके साथ फिर से किसी नए विषय को लेकर आपके साथ मिलेंगे। और जैसा कि डॉक्टर रविंद्रा सर ने अभी कहा कि हम जल्दी ही डॉक्टर योगेश कोडकानी सर, नीलिमा मैडम, हेमंत ठक्कर सर के साथ एक टॉक प्लान करेंगे डिफरेंट टॉपिक्स को लेकर, क्योंकि मुझे बहुत सारे चैट बॉक्स में मैसेज अभी आ रहे हैं कि अवर स्टूडेंट्स आर इंटरेस्टेड फॉर द लर्निंग दिस थ्योरी इन द डिटेल। तो मैं हमारे आज के स्पीकर से रिक्वेस्ट करूंगा कि जब भी हम कोई डेट्स प्लान करते हैं आप हमारे साथ जरूर जुड़ें। और अपकमिंग मंथ अप्रैल में हम इंदौर में एक ऑरिकुलर थेरेपी को प्लान करने जा रहे हैं, जो कि फिजिकल ट्रेनिंग है, और मैं आपको उसके लिए अभी से इनवाइट करता हूँ। 27, 28 एंड 29 April we are conducting the auricular workshop by Shri Vengudu Vetti. He is the very best master in the auricular therapy. तो आज के सेशन को हम क्लोज करते हैं। इसके सर्टिफिकेट्स हम इस बार नहीं आपको दे रहे हैं, हमने सिर्फ उन्हीं लोगों को इनवाइट करने के लिए इसमें रखा था who are interested to learning the acupressure और acupuncture sciences। और आज के सेशंस को क्लोज करने के लिए मैं इनवाइट करता हूं साक्षी जी को कि जो क्लोजिंग प्रेयर के साथ में करें। थैंक यू वेरी मच।
थैंक यू सो मच सर। इस फ्रूटफुल एक्यूकॉन का समापन हम सभी ईश वंदन और धन्यवाद के साथ करेंगे। मेरा सभी से निवेदन है, पुनः एक बार दोनों हाथों को नमस्कार मुद्रा में जोड़ें, पलकें सहजता से बंद कर लें, मन में अपने इष्ट का स्मरण और सभी के मंगल की कामना के भाव के साथ प्रार्थना दोहराएं। ओम सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामया, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःख भाग् भवेत्। ओम शांति शांति शांति। नमन करें, relax yourself. We'll meet again in such kind of